Good afternoon. My name is James Valentine, and welcome to the externally led patient-focused drug development meeting for Pompe disease. We're coming to you live from the Washington, D.C. metropolitan area, actually not too far from where the U.S. Food and Drug Administration's headquarters are located in Maryland. To open today's meeting, it is my pleasure to introduce Paul Mehlmeyer, the Director of Regulatory Affairs for the Muscular Dystrophy Association. Paul?
Well, thank you very much, James, and welcome everybody to today's externally led Pompe disease patient-focused drug development meeting. I am Paul Mehlmeyer, Director of Regulatory Affairs at the Muscular Dystrophy Association, and I will be co-moderating today's meeting. For over 70 years, the Muscular Dystrophy Association has served the neuromuscular disease community, including the Pompe disease community, through innovations in research and innovations in care. We have funded over $1 billion in neuromuscular disease research and currently operate clinical care centers in over 150 medical centers across the United States. We know that one of the greatest priorities for the entire Pompe disease community is the development and subsequent access of better therapies to target and treat Pompe. We are proud to continue to play an integral role in funding some of the most promising interventions in Pompe. But in order for a new treatment to truly make a difference, it must be meaningful to the community that it is intended for. And that is exactly why we are here today, to discuss what is truly meaningful to the Pompe community. We will hear from you on what symptoms of Pompe are most challenging. We'll hear from you on how your experience of Pompe has changed over time. We'll also hear about what symptoms you wish could be treated in a new therapy and your perspectives on your current treatment options. This is critical, as today is an integral step in integrating the Pompe disease community voice into every decision that the Food and Drug Administration makes. As you'll soon hear from our FDA speakers, what you, the community, says today will influence how FDA considers the benefits and risks of a new treatment, as well as how the biopharmaceutical industry structures their clinical trials, decides what symptoms to target, and much, much more. Today is your chance, with your voice, to make this a reality. Now, as you remember, today's meeting is actually rescheduled from an in-person meeting that we had initially planned for March 9th, but as we all know, the pandemic got in the way of that. But considering that it wasn't looking promising for us to reschedule a meeting of over 200 individuals from the community, all to fly to Washington, D.C., really anytime soon, today's lessons just couldn't wait any longer. So before handing it off to our first speaker, I want to start with a few moments of gratitude. First, I'm incredibly grateful to our partners and our co-presenters, the United Pompe Foundation and the Acid Maltase Deficiency Association. We truly could not have done this without you. Next, I'd like to thank Sanofi and all of our sponsors for supporting today's meeting. And then I'd like to offer a big thank you to the Food and Drug Administration for not only joining us today, but also providing us with invaluable advice and guidance as we prepared for today's meeting. Dr. Katie Donahue, Dr. Wilson Bryan, Shannon Cole, and Meghana Chalasani, thank you all so much. Today we have fantastic speakers with incredible biographies lined up, but really in the interest of time, we can't go through it all. So instead, I would invite you to check out our program book, which is on the very same webpage that you found today's live webcast link. Just scroll down a little bit further, find the program book, and read all about our amazing speakers. Speaking of amazing speakers, I'm pleased to introduce Dr. Priya Kishnani, who for many in the community really truly needs no introduction. She is the Chief Division of Medical Genetics at Duke University and will be providing us today with a scientific and clinical overview of Pompe disease. Dr. Kishnani, take it away.
Thank you. Good afternoon, and thank you so much, Paul and members from the MDA as well as the FDA, and most importantly to our patients for giving me this opportunity. These are my disclosures. Next slide. So I really want to remind all of us here, we have to recognize that Pompe disease is a continuum of disease spectrum. And at one extreme is what we call infantile Pompe, and everything outside of infantile Pompe is late onset Pompe disease. So what exactly is infantile Pompe? It is those babies who present in the first 12 months of life with cardiac involvement, which specifically is a hypertrophic cardiomyopathy or a thickening of the heart muscle. And as we've learned now through time, this can be anywhere right from birth, even before birth, to within the first few days to weeks of life. And these babies, as we have recalled it or as we've presented it in the literature, typically succumb to the disease within the first 2 years of life. I want to come back and revisit this in the next slide, but let's talk about now late onset. Sorry, just go back one slide here. Late onset is everything outside of infantile Pompe. And so whilst we've thought of late onset as adults with Pompe disease, it really could involve babies in the first 12 months of life as well, because now newborn screening has shown us that there can be cases with late onset Pompe disease that present in the first year of life. We've seen some of those cases clinically, but then there's a wide spectrum anywhere from the first year to up to the 6th decade of life. And the primary distinguishing features between infantile and late onset is the lack of a hypertrophic cardiomyopathy in the first year of life. It does not mean that late onset cannot have some form of cardiac involvement. Next slide. I also want us to know at the level of muscle what really is going on. And so just look at the cartoon above. To the one extreme left, we've got healthy muscle, and these are the individual muscle fibers, and the yellow is the lysosomes. And to the right is damaged muscle. And what you can see, it's no longer looking healthy and brown, but rather it's now distorted in terms of size. And also there is an extravasation of material outside of the lysosomes, which also includes the material that's building up in Pompe disease, which is lysosomal glycogen. So we want to really capture our patients at this stage so that we can really change the clinical course, but also for us to remember that these changes which are occurring at the level of individual muscle fibers are very, very variable, not just between fiber to fiber within a muscle, but between different muscles. Next slide. And now I want to come back to infantile Pompe. Remember, I mentioned to you that they typically succumb in the first 2 years of life. Yet, even infantile Pompe disease is a spectrum of disease from classic infantile to non-classic infantile. The point here is it's from most severe to less severe. And there is cardiomyopathy in the first year of life, but the cardiomyopathy and the rate of progression of the cardiomyopathy changes from classic to non-classic. So non-classic, it also presents in the first 2 years, in the first year of life, but it does not progress at the same rate or does not result in imminent death in the first 2 years of life. And so if we break this down further, classic infantile Pompe disease at the most severe end is CRUM negative. So these are patients who have 2 pathogenic variants, which results in absolutely minimal to no enzyme activity. So there's no protein that you would see on a Western blot. So these are the most vulnerable or the complete extreme at one end of the spectrum. And then there's this gradation of CRUM positive that occurs from classic to non-classic. And if I were to draw this chart out further, it would also include late onset. So all late onset cases are CRUM positive. There's a subset of infantile patients that are CRUM negative and others which are CRUM positive. Next slide. And so what are the lessons that we've learned from treatment with enzyme therapy with L-glucosidase alpha? Next slide. So here you can see this was the pivotal clinical study, which was in babies who were less than 6 months of age and who were not on invasive ventilators when they started treatment. And you can see that at the end of the year, of 1 year on treatment, so when they were approximately 18 months of age, all of them were alive. But if we follow these children out further, you can see that there was a drop-off and there were some babies that we lost along the way. So then by the end of this extension of the study extension end, which is around 42 to 45 months, we had 72% of the children who were now alive, so about 1/4 were lost along the way. And if you compared it to the natural history of classic infantile now, so those who would have succumbed in the first 2 years of life, the survival would have only been 2% or less. So a dramatic change in terms of the ability of what enzyme therapy does. Next slide. And this is largely because of the dramatic response to the heart. Can you go back one slide, please? So you can see the heart before and 12 weeks after enzyme treatment, a dramatic reduction in heart size. And so now when we look at the factors which affect the response, I think I already pointed out the age and the disease duration upon ERT initiation. So the younger the age and the less the disease severity at baseline, the better the response. The degree of overall muscle damage and extent of pre-existing pathology, that's another given. Then the predominance of muscle fiber type. This was very nice work from Dr. Nina Rabin at the NIH. And then the further understanding, again from Dr. Rabin, of the degree of disordered cellular processes such as defective autophagy, mitochondrial dysfunction, etc. And then the contributors of other genes outside of the Pompe GAA gene. And then again, we touched upon CRIM-negative status. As you can imagine, if they don't have any residual enzyme of their own, when we administer the IV L-glucosidase alpha, the body treats this as foreign, and they don't do well with the treatment because they're developing antibodies. And then any kind of, even the CRIM-positive patients can develop antibodies to the enzyme and not do well. Next slide. And so what have we accomplished since the advent of ERT? I do not want to minimize. We have saved the lives of our children. We have prolonged the lives of our adults and improved the quality of life, yet there are long-term issues. So from a heart perspective, there can be scar tissue that is noted. There can be heart rhythm disturbances. There can be involvement of the blood vessels of the heart. Then we're starting to also recognize that there could be a neurologic component like sensory neural hearing loss, anterior horn cell involvement, and white matter changes in the brain. This I really want to emphasize. At this point, the children are doing really well. And so if we're thinking about neurologic involvement, we have to understand what are we trying to treat. At this point, our children are doing well. Many are in college doing really, really well. And then we've also noted hypernasal speech, and then eye findings like weakness of the eyelid muscles and also a severe myopia. We've also noticed sphincter issues like bladder and bowel challenges that these children face. Next slide. And then we've noted that there are persistent of motor findings. So yes, these children are now able to walk and make motor milestones that they could not have done before. But yet we do find some persistent weakness like neck flexor weakness, weakness in the ability of the ankles, to dorsiflex or to move down. There's a persistence of weakness of the hip extensors. They continue to have weak facial muscles. And as a result of all this, they can have osteopenia or low bone density and an increased risk of fractures. So we do have an emerging phenotype with similarities, but yet some differences. And really, it likely is related to the extent of disease pathology and the very limited residual enzyme activity that infantile cases have. Next slide. But the features in common for the long-term survivors are those who started young, and I want to say how wrong I was when I just said less than 6 months. They were all CRIM positive. They did not have invasive ventilation at baseline, and they had all tolerized to the enzyme. So again, the take-home message is that these are the great positive predictors for doing well on enzyme replacement therapy. Next slide. But here's the good news. We've made some progress here. We've now got Pompe disease on newborn screening. And today there are 22 states which are in orange, which are screening for Pompe disease as of July 2020. So this was a process that I know I initiated in 2008 with the nomination. So this is significant progress because now not only do we pick up infantile cases, but also late onset cases, and we're understanding the phenotype of these children with late onset Pompe disease. Next slide. If you recollect, I had talked about the challenges with high sustained antibody titers. So we have developed a protocol of what we call immune tolerance induction, or ITI. And this is a short course of immune modulation, not delaying when enzyme would start or stop. And you can continue with the enzyme after the short course of enzyme of immune modulation. Next slide. And here's another nice success. We've now been able to have, or there's now an FDA label change as of February 2020. Now, CRIM assessment is important to be done and is mentioned in the package insert, and that immune tolerance induction administered prior to and in conjunction with initiation has been reported to aid tolerability of the enzyme in CRIM-negative patients. So we've tried to overcome two of the barriers, the risk of these high titers, which if we did not know what was going on, and early onset of treatment. Next slide. So questions, as I said, that are coming up is the nervous system involvement and does it impact cognition? The latter I can say to date, we've really not seen cognitive decline. The children are really bright and are doing well, but we're continuing to monitor. Next slide. And so let's now talk about late onset. We've touched upon this already. There's a lot of variability. They can present from the first year of life to as late as the 6th decade. And what's important here in the US is to know that up to 60 to 90% of our patients with late onset Pompe disease have this one common leaky IVS splice site mutation. And then, of course, they can either have the second genetic change also as the splice site mutation, and they typically do not have much of a clinical course, but we see some outliers. And then the others, the vast majority, have a second genetic change. And here is where we need to understand more, because many of these children can have this combination of mutations and present at various ages, and there's a lot of intrafamilial variability. So siblings can present very differently. So a lot to be learned from this rare disease and other autosomal recessive conditions. Next slide. And here is again showing you the muscle involvement heterogeneity. If you just look at this from a patient with Pompe disease, you can see this completely normal muscle fiber. Here, there's wherever you see these little white dots, that's where the glycogen has accumulated and has been leached out when we stain for it. Here, there's much more involvement. And you can also appreciate that the size of these individual fibers are very variable. So these biopsies can look very different from looking almost normal to looking very, very involved. And so you can have a normal muscle biopsy in up to a third of cases who are symptomatic with late onset Pompe disease. So another important message that it's you find what you're looking for and where you're looking for it. Next slide. And then in terms of mortality and morbidity, we talked about the early mortality in the infants with Pompe disease. But here is some very nice work from the Dutch group. When they looked at 268 Dutch untreated adult patients, what was definitely learned is that the morbidity increases with time. So with each passing year, the likelihood of need for use of a ventilator, the likelihood for need to be a wheelchair user increases. And so the 5-year survival for patients without a wheelchair or respiratory support was 95%, and wheelchair bound and use was 74%. So really to tell you that the disease is progressive and it does change over time. And here the median age of diagnosis was 38 years, and the mean years of survival after diagnosis was about 27 years. So we're definitely losing our adults with Pompe disease at an earlier age than otherwise. Now remember, this is the untreated adults with Pompe. Next slide. And so if you again look at it in another way, if someone was first diagnosed at 28 years, by the time they are 49 years, so 2 decades later, they would need ventilator support and probably require some form of artificial ventilation. And about a decade into their disease, they would start requiring the use of wheelchair support. Next slide. Next slide. Yeah, and so now what has enzyme treatment done? Really want to show you again, if we look at this aspect here, these are untreated patients with late onset Pompe disease. And if they were continued to be untreated, we expect that their muscle strength would continue to go down. And this is when you intervene with enzyme treatment, you find that there is now an improvement in their muscle strength. And this really shows us that enzyme therapy results in better muscle strength compared to the natural history. Next slide. And the same applies now to respiratory function. So when you look at it from a measure of forced vital capacity, This is the course before treatment. This is what the course would have been without treatment. And this is now the patients with treatment. So once again, showing you an overall stabilization of the forced vital capacity over time. And so once again, next slide. The message again to give here is that there is a benefit as measured by forced vital capacity and the 6-minute walk and muscle strength. And then patients with late onset, again, to bring it back full circle, it's a continuum of disease. They can have cardiac involvement, and this is something we need to look out for. Some of them present with heart rhythm disturbance like WPW. Next slide. This is again from the Pompe registry, so giving us real world data. And this line here is actually really showing us that over a period of time on ERT, the forced vital capacity in patients with late onset Pompe disease remained quite stable. Now, we have noted what the natural cause would have been. So to me and for our patients, I think they recognize this, that stabilization of the disease course is actually an improvement. Next slide. And so we are uncovering, again, that there's beyond skeletal muscle and heart involvement. We now know that there is smooth muscle involvement. We already started to recognize this by noting that there can be vascular manifestations. But here you can see that it affects the aorta, the blood vessels, it affects the GI tract, and many of our patients do complain of difficulties in terms of bloating, in terms of diarrhea or alternating diarrhea and constipation. And there's also glycogen accumulation in the smooth muscles of the airways. So clearly, this is another target for treatments. Next slide. And here is really showing you that a presenting feature or some that can develop in a patient with late onset, and for that matter, even with infantile Pompe disease, is an aneurysmal dilatation of the basilar artery, which is a blood vessel in the brain. And in fact, this can be a catastrophic event and be the presenting feature of someone with late onset Pompe disease. Next slide. And this is showing you that there can be blood vessel involvement in terms of an aneurysmal dilatation of the thoracic aorta. You can see this, that this is dilated here. It's dilated here. And this is probably due to the same pathologic process that occurs in the brain, the smooth muscle involvement of these blood vessels. Next slide. And so again, as a reminder to us, and this really should be Pompe disease is a multi-system disease, but more so for our understanding for late onset Pompe disease, we recognize that there's tongue weakness. We know that there are vascular manifestations. We know that they can present or develop cardiac manifestations over time, including a cardiomyopathy or left ventricular hypertrophy. They can have skeletal manifestations in terms of scoliosis and a rigid spine. They can present with eyelid muscle weakness or ptosis or develop this over time. They can have bladder and bowel incontinence as well as GI manifestations. Next slide. And so in summary, there has been significant progress in the field of Pompe disease since the advent of ERT. We have learned many, many lessons about the impact beyond the skeletal muscle and heart. There's now a new understanding of the phenotype across the disease spectrum, factors that impact the treatment response, the need for continued learning, and of course, what can we do better for our valued patients and their families with Pompe disease. Next slide. I really want to acknowledge our team at Duke, but most importantly, our patients and their families and their willingness to help us learn as we have continued through the years. Next slide. And also to the many, many patient organizations, the advocacy groups, and the other funding sources. Next slide. Yeah, so that's what I needed to present today in the few minutes that I was allocated, and I'm looking forward to a very successful meeting today.
Well, thank you so much, Dr. Kishnani. It's truly incredible how much information you can fit into such a short amount of time, and we're so grateful for your time today. Next, we have Dr. Katie Donahue, Acting Director of the Division of Rare Diseases and Medical Genetics at the Center for Drugs at FDA. Dr. Donahue, we're grateful for having you here as well. Please take it away.
Good afternoon, everyone. I'm happy to be on the call with so many patients and caregivers and advocates. I'm honored to join you. Thank you all for being part of this meeting and sharing your experiences with us. And I'd also like to thank the Muscular Dystrophy Association and all of the staff who were involved in planning this meeting, not once but twice. I really admire your perseverance in the middle of a pandemic, and I'm glad that you have rescheduled. Having this kind of dialogue is extremely valuable for us because hearing what patients care about can help us really lead the way in figuring out how best to facilitate development of new treatments for patients living with Pompe. I cite Voice of the Patient reports all the time in my work with pharmaceutical companies because while I work with them, I work for you. And so these reports can be a powerful tool in persuading companies to choose broader enrollment criteria so that as many patients as possible have access to new therapies by enrolling in clinical trials. And these reports are also really powerful in persuading companies to measure endpoints that really matter to patients. I do also want to briefly touch on the regulatory perspective about how COVID-19 is affecting drug development for patients with rare diseases. I know that living with Pompe was difficult enough before the outbreak of this pandemic, and now pretty much everything is even harder. Clinical trial disruptions, pauses on enrolling new patients, drug shortages, challenges accessing care, and of course, unemployment and the loss of health insurance is a really, really big stress for families living with this disease. So I can tell you that we in the agency are working closely with companies to prevent drug shortages, and I'm seeing that rare disease drug development remains a top priority for the agency, even in the middle of all of the strains of the pandemic. Many review divisions were asked to send reviewers to help with COVID-19 work, and I just want to let you know that my division has been protected, so all of my reviewers are still working exclusively on rare disease applications, and as a result, we're actually doing better. So we had a little internal reorganization right at the beginning of the pandemic, where my division spun off from the GI division, and already that is bearing fruit. So we're meeting a much higher percentage of our deadlines. We're right on track at about 90% of the time, which is progress. So even in the middle of the pandemic, I see a silver lining there of improvement. And I also see a silver lining in the sudden move toward platform trials to test COVID therapies. So platform trials are a really powerful tool for advancing treatment. Instead of each company having to build a clinical trial from scratch, they allow us to test multiple treatments within the same infrastructure. We can randomize far fewer patients to the control arm and often generate answers much more quickly. So I hope that we can start to see the widespread adoption of what we're learning from platform trials in COVID to platform trials in rare diseases. And one powerful thing that this community can do to advance treatments for Pompe disease is to advocate for companies and academic investigators to donate their placebo arm or natural history data to the Rare Disease Cures Accelerator. So the FDA has partnered with CPAS to create this platform, and they are a trusted partner and a trusted broker. They've worked with a lot of the neurologic disease foundations and Alzheimer's and Duchenne and some others to pull in natural history and placebo arm data from multiple stakeholders, and they can build it into a clinical trial simulator that makes it a lot easier for companies to develop successful trials. So that's a real opportunity for this community that I just wanted to put a plug in for. Happy to chat with you more about that another time. But the bottom line is today is about you. So we're grateful to each of you for being here, for sharing your personal stories, experiences, and perspectives. We look forward to incorporating what we learned today into our work, developing new treatments for this community. So I look forward to learning from you today. Thank you.
Well, thank you so much, Dr. Donahue. We're, again, very grateful for your time. Something Dr. Donahue mentioned is a Voice of the Patient report. We're going to be publishing the results of today's meeting in a Voice of the Patient report. Dr. Donahue and all the other FDA reviewers will be citing and looking at that report as they're considering new therapies for Pompe. So, Dr. Donahue, thank you. Next, I'd like to hand the program over to my co-moderator, James Valentine. James, you've been a friend and ally of the rare disease community for many years, and you've worked as a champion of the patient voice in drug development for 12 years now. Following working at FDA as a patient liaison, James has been integral in ensuring the success of patient-focused drug development meetings such as today's, and I can promise you that we're in no better hands. James, take it away.
Thank you, Paul. Yeah, so now that we've had a chance to hear that clinical overview from a disease expert, and we just heard from a colleague from the FDA, we now get to turn to the core of today's meeting, which is to hear from you, patients and the direct caregivers of individuals with Pompe, to help understand the experiences of those of you living with Pompe disease. As you heard, patient-focused drug development is a more systematic way of gathering the patient perspective in your condition and on available treatments. So as you heard from FDA's Dr. Donahue, your input can help inform the agency's understanding of Pompe to inform drug development and review. So far, FDA has held 26 of its own patient-focused drug development meetings, and today marks the 36th externally led patient-focused drug development meeting. And due to the ongoing COVID-19 pandemic, today is actually the fourth fully virtual PFDD of its kind. Today's meeting is designed to be interactive, so I wanted to spend just a couple of minutes telling you about what we'll be asking of you. First, in terms of the topics we'll be covering, first we're going to be exploring the patient and caregiver experience with living with Pompe and its impacts on your daily life. We'll do this first with patients with infantile and early onset Pompe and their caregivers. Then we'll have a discussion with those with late onset Pompe. Then we're going to build on those discussions, and in our third session, bring everybody back together to explore the various approaches to treatment, and we'll also be asking you for your preferences for future treatments and regarding participation in clinical trials. What will those three discussions look like? Well, we have a number of methods that we're going to be using to hear from you. We're going to kick off our discussions hearing from panels of patients and caregivers that are living with Pompe. We've asked them to set a foundation for the discussion today, and they were selected to reflect a range of experiences with Pompe disease, both from the patient and caregiver perspective. However, we recognize and know that will not reflect the full range of experience with the condition, and that's why we're going to, following those panels, move and broaden the discussion and bring in those of you that are in the audience today into that discussion, all of you patients and caregivers. We're going to do that by asking some questions, posing some questions to you. I'll be inviting you to participate in a few different ways. The main ways that we'll be asking you to participate is by calling in by phone. We'll be sharing that phone number throughout the program today, as well as by written comments, which will be we're collecting in real time throughout the day in that comment form that is below the live stream on the PFDD web page that you're on to view this meeting. We'll also be bringing in a panel of Zoom participants that are patients and caregivers from your community to also add to that conversation. We'll also be broadening the input today through a series of live polling questions. We'll be asking patients and caregivers only to use your phones, another device, or if you want to, you can open a new tab in your web browser, and I'll direct you to that web page, and you'll be able to follow along just on that web page. It'll update with new questions throughout the whole course of today's meeting. We'll be getting your input that way. And importantly, we know that we have limited time today, and we're going to try to hear as many different patient and caregiver voices as possible, but we're going to extend the collection of written comments through that web form for an additional 30 days after today's meeting. So that's another opportunity for you following today to share your voice. Or if you're listening to this on demand right now, you can, if it's within 30 days of today's July 13th meeting, we welcome you to submit your comments as well. All of today's input, both the live input, the written input, will be summarized in that Voice of the Patient report that Paul referenced, which will be provided to the FDA, but also be made available broadly for researchers and developers. So one last thing before we go ahead and get into it and start getting your input, I want to cover a few ground rules for today's sessions. We encourage our individuals that are living with Pompe and their direct caregivers, whether you're a parent, a spouse, another family member, to contribute to the dialogue. We ask that you encourage you to participate in this polling, call in by phone, and write in through those written comments. However, the discussion today is going to be limited to only individuals with Pompe and those family members and other direct caregivers. Our stakeholders at the FDA, with drug development companies, clinicians and researchers, they're all here to listen. And so we are glad that you're here with us today in that listening mode and are very grateful for your time and attention. I also want to mention that views today are going to be inherently personal in the nature of the questions that we're asking, and we understand that the discussion may get emotional at times, and that's okay. But we do ask that you please provide respect for one another, and to that end, we do ask that you try to be focused and concise in your comments so that way we can hear as many voices from this community as possible. So without further ado, let's go ahead and get this meeting started, and we're going to go to our first set of live polling questions. These are questions to get a sense of the demographics of our participants today. This is a time to pull out that phone, open up a new tab in your web browser, and type in www.pollev.com/Pompe. That's the URL that you see listed at the top of this slide. Again, that's www.pollev.com/POMPE. This will be the same website that you'll be able to stay on all day and be able to follow along on the questions. They'll update automatically. So here we want to understand where you currently reside. Your options are A, in the EU5, which is UK, Italy, Germany, France, or Spain, B, in the Middle East, C, in Asia, D, in the US Pacific time zone, E, in the US Mountain time zone, F, in the US in the Central time zone, G, in the US in the Eastern time zone, H, in the US in the Alaska time zone, I, US in Hawaii time, J, in Canada, K, in Mexico, or L, some other country or region that is not listed on this slide where you currently reside. Again, this is for our patients and our direct caregivers. We're very interested in knowing where you currently reside. So we'll give you just a few more moments to get in your responses here. These demographic questions are going to be fairly straightforward, we hope, and we're going to get to some more interesting questions later in the program that probably will take a little bit more thought for you. So as the final results are coming in here, it looks like about half of our participants today are in the US on Eastern time. We also have good participation. About a fifth of our participants are on Central time, and about 15% are in the US on Pacific time. We do have representatives from the EU5, from US in Mountain time zone, and some from Canada. So we're looking forward to all of your participation today. We could go to our second polling question. So here we want to know if you're a patient or your loved one, if you're a caregiver, is male for A, B, female, C, non-binary or non-gender conforming, or D, if you prefer not to answer. So here all of these questions are going to be about the individual with Pompe disease. If you're a patient, answer on behalf of yourself. If you're a caregiver, answer on behalf of your loved one. And the options, again, are on the slide here. Please select the response that most closely fits the individual with Pompe that you're responding on behalf of. All right, so while final results looks like they're trickling in, it's looking like the greater proportion of our participants are individuals with Pompe that are female. Looking somewhere between 60 to 70%, and then our male participants, it's looking like somewhere between 30 to 40%. If we could go to our next polling question. So here we want to know, how old are you if you're an individual with Pompe, or your loved one if you're a caregiver? How old is the patient that you care for? The options are A, younger than 18 years, B, between 18 and 30 years old, C, between 31 and 50 years old, D, 51 to 60 years old, or E, greater than 60 years old. All right, so we'll give you a few more moments here to get your responses into this polling question on how old are you or your loved one. We're seeing really good representation across the board here, which is great to see. Individuals across all age ranges, although it's looking like our top kind of categories of age are those in the 31 to 50 year range, and those that are in the younger than 18, although we have really high participation in the 18 to 30 year range, and even in the 51 and above categories.
And James, what this tells me here, what Dr. Kishnani said was that it's really a spectrum disease, Pompe disease, and that's even illustrated in our polling here with individuals with Pompe, all the way from, just being born almost all the way to over 60 years old, really a broad swath of the community and a broad swath of experiences. You see that here with this poll.
Absolutely. Thank you, Paul. So with that, if we could go to our fourth polling question. So here, we would like to know the age at which you or your loved one first had symptoms of Pompe. So this is not the age of diagnosis. We'll actually have a question on that. Here we want to know, if you look back, think back, maybe maybe it's kind of a rough idea, but at which age did you or your loved one first have symptoms of Pompe? The options are A, between ages of 0 to 5, B, between 6 to 18, C, between 19 to 30, D, between 31 to 50, E, between ages 51 to 60, or F, if you had your first symptoms at older than 60 years of age. So this is the time of first symptoms experienced of Pompe for you or your loved one. We want your best guess. We know that sometimes it can be a little hard to be sure exactly of if it was a particular experience was the Pompe or if it was something else, but we want you to kind of think back and make your best estimate of that age. So as it stands, it looks like the greatest age range is in that 0 to 5 age range, with a little under half of our participants noting that as being when they experienced their first symptom of Pompe, and then about a quarter of in that 19 to 30 year age range, and about 20% in the 31 to 50. We're seeing about 10% in the 6 to 18 year range, and very few people, around just 2% in the 51 to 60, and no one rating, selecting that their first symptom was when they were older than 60 years of age. So if we can move to our next polling question. So here we want to actually know about that diagnosis. So at which age were you or your loved one actually then diagnosed with Pompe? And the options here are between ages 0 to 5 for A, for B, ages 6 to 18, C, ages 19 to 30, D, ages 31 to 50, E, ages 51 to 60, or F, if you were diagnosed when you were older than 60 years of age.
And this is really interesting, James, because what this shows us, especially seeing a good number of individuals diagnosed between the ages of 31 and 50, that the results here are skewing older than in when individuals were first experiencing symptoms of Pompe. That really goes to that diagnostic odyssey the individuals with Pompe face, that perhaps they first experienced symptoms between the age of 0 and 5, but somewhere in adulthood, maybe even between 30 and 50 years of age, that's when they were finally diagnosed.
Yeah, you're seeing, even though it's that 0 to 5 age is still one of the top selections here, the overall percentage is lower. All right, if we can move to our next polling question then. So here we want to know what type of Pompe that you or your loved one have. The options here are A, classic infantile onset Pompe before 1 year with heart involvement, B, late onset with symptom onset between 0 and 10 years of age, C, late onset with symptom onset between 11 and 20 years of age, D, late onset with symptom onset between 21 to 45 years of age, E, late onset with symptom onset after 45 years, or F, if you're unsure what type of Pompe you or your loved one have. All right, we'll give you a few more moments here to get your response in on the type of Pompe that you or your loved one have. As it stands, it looks like the greatest category coming in, a little over a third, is the late onset with symptoms between 21 to 45 years. A little under a third of our individuals with late onset between 0 to 10 years. And then about a little over 15%, somewhere between 50 to 20, with the classic infantile onset. But we do have representation across the other categories, and we do have some individuals that are unsure or have some other type of Pompe that's not listed on this slide. If we go to our final demographic polling question. So here we want to know, how were you or your loved one diagnosed with Pompe? And we know that because some of these diagnostic approaches can be done, you kind of further confirmed, or as new types of testing become available, you may have been diagnosed or had that diagnosis confirmed. So here we want you to select all that apply. So did you get a diagnosis through A, newborn screening, B, a clinical diagnosis based on symptoms, C, a familial diagnosis based off the diagnosis of a family member, D, genetic testing, E, enzyme level testing, or F, neonatal testing? I should point out here, this is the first polling question that we've seen where individuals can respond with more than one option. And so what you're seeing is a percentage of overall responses. So for example, you're not seeing about 40, it's not 40% of people have a clinical diagnosis. It's actually going to be more than that. It's just that 40% of our overall responses are for a clinical diagnosis. So the best way to think of this is as a ranking. So we'll give you a few more moments here to get in how you or your loved one were diagnosed with Pompe, and we want you to select as many that apply. As it stands, it looks like the top category of diagnosis has been genetic testing, followed by clinical diagnosis, and close behind that, enzyme level testing. We're seeing very few, about 5% of the respondents today saying that they were diagnosed through newborn screening, and only a few saying that they were diagnosed through familial diagnosis. No one reporting a diagnosis through neonatal testing. So we want to thank you all for participating in this first set of polling questions. That gives us a really good sense of the population that we have represented today from this community. And we're going to be coming back to these polling questions, so keep that phone around, keep that tab open. We'll come back to that throughout. So now we move into our first session of today, which is going to be our first session where we're talking about the direct symptoms and health effects of Pompe and how they impact daily life. So if I could have our discussion questions projected here for a moment. Here we want to have a discussion exclusively with those that are living with infantile or early onset Pompe disease. We want to get a sense of the different symptoms that you experience, and in particular, those that you report as most burdensome in your life. We want to get a sense of how those symptoms have changed, whether that be day to day, week to week, month to month, or even over the course of years of experiencing the progression of the condition. In understanding those burdens and why certain symptoms are most burdensome, we're going to ask you to also tell us about other activities in your life, things that are important to you or your loved one that they or you cannot do at all or as fully because of those burdens, direct burdens of Pompe disease. And finally, we understand that in a condition like Pompe, not all of the manifestations of the condition will have already been experienced, or maybe not as severely yet. And so we do want to ask you about your worries and fears for the future as you get older with living with Pompe, and specifically any capabilities that you're concerned about potentially losing as you get older. All important things that we will discuss today. So to get us started on this, we have a great panel of members of this community who will be sharing their experiences with Pompe, with infantile and early onset Pompe specifically. We have Paloma, Sarah, George, and Deanna. And Deanna, due to an accident, wasn't actually able to record her own statement, so it was recorded by another member of the community. That's why you won't hear her voice. However, I'm happy to say that she's recovered and is actually able to participate live today. But let's go ahead and have Paloma start us off.
My name is Paloma Juarez, and my boyfriend Brian and I are the proud parents of Vaughn Sanford Way, an energetic, bossy, bright 4-year-old. In August, Vaughn will be promoted to Big Brother as we are expecting twins. Shocked and thrilled, our excitement is tempered. Vaughn and one of his brothers will share a journey of working through life living with infantile onset Pompe's disease. They both have the same rare double mutation. As daunting and overwhelming as the second diagnosis is, we are also very fortunate. Vaughn has trailblazed a unique and successful path in his journey for this once extremely fatal disease. We have learned much about what is important and vital to living with IOPD, and I'd like to share these with you today. Early diagnosis. Vaughn was born 4 years ago in Kansas City, Missouri. At 6 days old, we were informed that Vaughn's newborn screening had flagged for Pompe's disease. At that time, Missouri was only one of 5 states screening for the disease. Follow-up assessments at the local children's hospital confirmed our 9-day-old son had Pompe's. The pain and despair of that diagnosis was devastating, but we were fortunate that the news came early and that made a difference for Vaughn. Early diagnosis is paramount for IOPD children in not only saving their lives, but drastically improving the quality and type of life they will live. Enzyme replacement therapy. Early diagnosis allowed us to take the next step, education. We dug into the research as deep as we could go, reading every article, webpage, study, and white paper we could find. Through that, we discovered and pushed for treatment paths that improved Vaughn's journey. One was a study out of Taiwan indicating that starting ERT in the first 30 days of life drastically changed outcomes for IOPD patients. We now had a target. We learned about Dr. Priya Kishnani and her expertise with Pompe's disease. Our email pleading for any help she could give was quickly responded to with advice and assistance in setting a path. Her response changed our mentality from despair to hope. Because of all these things, at 23 days old, Vaughn had his first Lumizyme infusion. Knowing others in the IOPD community getting to ERT as fast as possible makes a huge difference. By 6 months old, Vaughn went from having significant hypertrophic cardiomyopathy to having a heart that returned to normal due to early ERT treatments. Immune modulation. Another challenge for Vaughn was he was CRIM negative, meaning he does not produce any of the GAA enzyme. CRIM negative patients have always been known to have poor outcome on ERT due to the development of anti-Rh-GAA antibodies. An immune modulation regimen was recommended by Duke. Our local geneticist made it a choice, not a necessary procedure for survival. We now know how vital immune modulation is. Vaughn has continued to have reaction-free infusions and has never developed antibodies. Had we forgone the immune modulation, Vaughn most certainly would have issues with his breathing and be on a respirator, as well as other challenges or even death. We believe that those early intervention methods are why Vaughn have been able to thrive and to live. His diagnosis wasn't a death sentence. Never succumbing to challenges, Vaughn exceeded expectations. Our team at Duke consistently gives us encouragement to be hopeful and stay aggressive with treatment and therapies. We don't wait to see a decline or a challenge before adding therapies or adjusting dosage or frequency. We're always working to push and improve the abilities Vaughn already has and adapt for what he doesn't. We have needed to push doctors, nurses, therapists, even family members outside their comfort zone to get what is best for Vaughn. We don't wait for people to give us answers. We research, become educated, and a part of Vaughn's journey. With speech, occupational, feeding, and physical therapies, Vaughn continued to grow and meet milestones. Increased dosage and frequency of Lumizyme have led to changes in Vaughn's strength, posture, and ability to use muscle groups. Vaughn and many IOPD kiddos have speech hypernasality, sound errors, and dysphonia. Oral muscle degradation has been Vaughn's biggest hurdle to overcome. With increased therapies and increased dosage of Lumizyme, we have seen tremendous improvement in Vaughn's ability to vocalize and eat. From being only able to vocalize 2 to 3 word approximations, Vaughn now talks nonstop. He is able to eat a variety of foods and maintains a healthy weight. Vaughn's buddy, Pedro, an augmented communication device, has allowed Vaughn to communicate with those listeners who have trouble understanding him. It has helped with Vaughn's frustration level and also has started him early in learning how to read. It can be emotional for us to watch other kids struggle to connect or understand Vaughn, but he is learning to adapt and handle these interactions more and more each day. We continue to work on strategies to help Vaughn verbalize in an efficient, effective way. In 4 short years, Vaughn's life is drastically different from the cases we read about at his diagnosis. He has changed not only what Brian and I believe possible for him, but is changing what doctors, therapists, and other families now know about children living with IOPD. Vaughn's story and experiences will shape his brother's life for the better in ways we never thought imaginable. Thank you so much for listening to our family's story.
Hello, my name is Sarah Musgrove, and I am mom to 2 infantile onset Pompe kids. Bruce is 9 and Myra is 2. That one sentence defines me maybe more than any other I can make, and it has been quite the journey to this point in our lives. John is dad and my rock on this journey. We live and raise beef cattle in northern Missouri, just 2 hours north of Kansas City. Children's Mercy in Kansas City is where the kids receive their primary specialist services, and our genetics team works incredibly well. We take a lot of recommendations from Dr. Kishnani and the Duke team, and we're ever so grateful for the 2 teams who work together and keep the kids' best interests at heart. Conversations are not always warm and fuzzy, but we do learn from each other. We share our concerns, and it is always a good team effort. So Bruce was clinically suspected to have infantile onset when he was 3 days old, and his official diagnosis came at 13 days old. He started Myozyme at 20 milligrams per kilo biweekly at that time, and he was discharged from the NICU when he was 6 weeks old. He had three doses under his belt. After 2 weeks at home, his PICC line became infected, and he landed himself back at Children's for a very long 3 months battle against bacterial meningitis. He had a brain abscess, and there was a host of doctors and nurses who had never heard of Pompe and were ready to give up on him. Our genetics team admittedly took the brunt of a lot of grief that we never imagined. But by the time Bruce was 2 months old, his heart had corrected to normal size thanks to enzyme replacement therapy, and Pompe was the least of our worries. By the time he was 6 months old, Bruce had overcome infantile spasms, hydrocephalus, and he was on the path to healing. Bruce started home infusions when he was 4, after he participated in the FDA-approved trial for Lumizyme for pediatrics, and he also had a successful cardiac ablation to correct an extra electrical pathway, thanks to Wolf Parkinson White. We struggled in the beginning to find an infusion company and specialty pharmacy that were willing to commit to this journey with us, and it was hard. As I grew more confident in my exposure to Lumizyme and infusions, and I knew this was something I could do for Bruce. So the same year that Bruce started kindergarten, I started nursing school, and I'm currently working on my master's in nursing to be a nurse educator to complement my lifelong status as Pompe advocate. Also, during nursing school, and against the recommendation of any nursing instructor anywhere, I became pregnant with Myra, and because we know too much about our genetics, we did opt for early testing. So she was diagnosed at 20 weeks in utero. She was monitored and delivered by the Fetal Health Center at Children's Mercy, the same place that was home to Bruce for so long. At 5 days of age in the NICU, she had her first dose of Lumizyme, and she was discharged home without all the complications that her brother experienced. Something we joke in our house that girls rule and boys rule. So John and I are fully integrated Pompe Chaos coordinators, as we have 2 kids on home weekly infusions. Bruce is holding steady at 40 milligrams per kilo, and Myra just finished her slow increase to the same double dose. After becoming an RN, the genetics team gave the blessing for me to mix drug access ports and administer infusions, just in time for the COVID pandemic to hit. And I have been the main nurse in charge for the last 4 months. That is truly my ultimate mom nurse goal has been achieved. Daily life for us looks as chaotic on the outside as it is on the inside. We treat each and every fever, runny nose, cough, and headache with extreme caution. Having an implanted port is a huge risk for blood infections, and unexplained fevers could mean a delay in enzyme replacement therapy for time to resolve that infection. With Bruce's VP shunt in his brain related to his history of hydrocephalus and bacterial meningitis, any headache could mean a malfunction, so that's got to be tested. Recently in December, both kids had fevers, and Myra's port was tested with cultures that came back negative. When her brother spiked a fever just a few days later, we had him assessed, and we collectively decided that we didn't need to do cultures. That's a mistake I'll never make again. As it turned out, he had Streptococcus parasanguinus bacteria growing in his port that required 10 days of IV antibiotics. He was fortunate to save his port, and I was able to administer medications at home, but he missed a dose of Lumizyme, and as we all know, each dose is crucial. Both kids walk. Bruce talks with some notable Pompe characteristics, such as hypernasality and articulation difficulties. Myra has severe speech delays, but she definitely gets her point across as a sassy 2-year-old. Bruce wears hearing aids, which helped tremendously with his word count when he received them at 4 years old. But Myra hears so well, she can hear me sitting too close to her dad from the next room over. Bruce still has his G-tube that we use for nutritious food, but he's got a keen taste for pizza and chips. Some battles are just not worth it. Myra will try anything once. She loves fruit, and she has just recently discovered ketchup as a source of comfort for her toddler woes. Bruce loves to people watch, and Myra loves to be the one that people are watching. While they are genetically connected to each other for the rest of their lives, seeing their differences and achievements is the best part of our job as parents, and we never take a day for granted. Thank you for this opportunity and for letting us share, and may your ears and hearts be open to the real Pompe life that you're learning about today.
Hello, my name is George Fox. My son Phoenix is 17 years old and was diagnosed with infantile onset Pompe disease when he was 6 months. Phoenix was born in Miami, Florida, and as noted by the neonatologist performing his initial screen, he was a strong baby. The doctor actually wrote down the word strong and underlined it. However, at 3 months old, during a routine pediatric exam, we were informed that Phoenix had a heart murmur and that he needed further investigation. Using ultrasound, Phoenix would be diagnosed with a potentially lethal heart condition called hypertrophic cardiomyopathy. However, hypertrophic cardiomyopathy is a symptom of several different possible conditions. We had to get to the bottom of it before it was too late. After a 3-month roller coaster ride and no answers, we were led by some unexpected contacts to Dr. Barry Byrne at University of Florida in Gainesville, a 7-hour drive from home, where we finally diagnosed Phoenix with infantile onset Pompe disease. Unfortunately, in this 3-month period of searching for a diagnosis, our son lost a tremendous amount of strength. He lost his ability to swallow and eat, crawl and kick. The use of his arms declined significantly. Most importantly, he was losing his ability to breathe. And also, his heart continued to get worse. Luckily, at the very same moment in time, Dr. Byrne's office was approved to test an experimental medicine, and Phoenix was accepted into the clinical trial, where only 6 people in the world were testing this new medicine, and Phoenix was one of them. Thankfully, the medicine stopped his heart from getting worse and gradually corrected it to where today he has an otherwise normal heart. However, this new enzyme replacement therapy was unable to correct his weakening muscles, and his ability to breathe continued to decline. Then, at 3 years old, Phoenix acquired pneumonia and was intubated. After that, he was unable to breathe on his own and had to undergo a tracheostomy procedure and was put on a ventilator 24 hours a day. He also had to have a G-tube placed for constant feeding and an infuser port to administer enzyme replacement therapy into his bloodstream. For the next several years, Phoenix would continue to ever so slowly decline in strength, and no other therapies would become available to stop this. And now, at 17 years old, our home is much like a hospital, with Hoyer lifts, oxygen tanks, a ventilator, respiratory equipment, suction machines, a defibrillator, and the list goes on and on. However, I do want to make an important clarification here. While most people look at us and feel sorry for us, we consider ourselves lucky. Even though Phoenix is profoundly disabled and we are inundated with life-giving equipment, we are still able to get out into society and live our lives. We are members of our community where we raise money for research, we give presentations about genetic conditions, we go to the movies, we go to the mall, we go to the grocery store just like everyone else. And it's all because, fortunately, we received a medicine that helped us get more time out of life. And also, we are the recipients of technology and medical equipment that is becoming more and more portable. This part of the system is working. However, I will say that it's not easy. I am Phoenix's full-time caregiver because it has been impossible in this area to find anyone that's capable of caring for a 100-pound 17-year-old on a ventilator 24 hours a day who is 100% dependent upon somebody else for his movement. We also had to learn how to care for G-tubes, tracheostomies, and understand how to operate ventilator proficiently, access his port, and help with infusions. No doubt about it, it is technically challenging, and not everybody can do this. It's for that reason more effective treatments are desperately needed. It is also very frustrating when we see upcoming clinical trials for potentially more effective treatments that more often than not, we are excluded from because of the ventilator. And sadly, it's coming to my understanding that we will probably be omitted from future gene therapy trials as well, because in 2010, we were in a gene therapy trial that targeted breathing insufficiency. The gene therapy initially had a noticeable positive effect, but the robustness was relatively short-lived, and after a couple of years, we were back to where we started. It looks like once you have been in a gene therapy trial, you are not allowed to enter another one. And from a treatment perspective, breathing is at the top of the list of importance for us. So for now, we will continue to do what we are doing, all the while raising money for research, advocating for better treatments, getting out into our community, and living life and crossing our fingers that the Pompe gods don't try to claim another young life far too soon. Thank you.
The following statement was prepared by Dina Bridges. Hello, I'm Dina, and this is my handsome 14-year-old son, Dakota. We live in Durham, North Carolina, and have since 2007. I'm going to share with you today how both infantile and late-onset Pompe have impacted our family. I'm a mother to 5 beautiful children, 2 of which have had infantile Pompe. We also have 2 cousins that had late onset. My son Mason is the reason I first learned of this horrid disease 19 years ago. Mason was extremely weak since birth and unable to hold up his head, sit, or nurse. He never hit his milestones. He was so weak that his cries were almost inaudible, only tears. When he would laugh, it was more like a squeal. Mason was a happy baby, even during his last days. Mason loved music, especially when I would hold him and dance around the house, patting his back to the beat. He was loved so much by his older siblings. Then everything changed. At 6 months old, Mason was diagnosed with infantile Pompe disease. What is Pompe? What do you mean there's no treatment, no cure? Why was this not detected at screenings at birth? How was this missed? I was told to take him home and just make him comfortable and love him, that there was nothing that the doctors could do at this time. I was not offered hospice care or any kind of help to prepare for his death. Literally, the only thing we could do was just watch him die. At 7.5 months old, Mason passed away from cardiac and respiratory complications. I cleaned and dressed my baby one last time before placing him in the casket. Our family fell apart after that. It wasn't just because they lost their baby brother, but they also lost their mother, for I have never been the same. In 2006, before having access to ERT, my cousin Marty passed away in her 60s from complications due to Pompe. Later in 2006, my cousin Abby was able to start treatment with Myozyme. She passed away this past January at 75. She would be very proud knowing that I am here speaking for our family. Now I'd like to share with you about this remarkable young man, my son Dakota. After our experience with his big brother Mason, when I became pregnant in 2005, I knew to keep an eye out for Pompe. Dakota was diagnosed with infantile Pompe in utero. He was born on Valentine's Day 2006. My absolutely perfect little baby with imperfect DNA. I knew I would sacrifice anything to try to save my baby. His doctors in South Carolina had a grim outlook for Dakota, and didn't expect him to live long after birth. Right away, we had an echo of his heart, which wasn't normally done, but I had been working with the wonderful team at Duke through the pregnancy and the birth and knew to make this special request. Dakota's enlarged heart seemed extremely large to the local doctors who were not familiar with Pompe. The doctors at Duke assured me that it was just slightly enlarged. I was bound and determined to honor his life, no matter how it was destined to be. When Dakota was just 10 days old, we started bi-weekly road trips for infusions of this new drug myozyme as a part of a trial at Duke. What a difference! I never saw him decline in any way, and was so happy to see him do the things that Mason was never able to do. He was gaining weight and didn't lack in strength. He was strong and not a floppy baby. Even with the incredible impact of this treatment, we remained cautious because I've seen what Pompe can do. I took a lot of precautions to help prevent him from getting sick, with my OCD antics of wiping everything with Lysol wipes and keeping sick people away. When we moved to Durham, I had to leave my family and other beautiful children that needed me to try to give Dakota life. We had a scare when Dakota started having reactions during infusions, but that was managed quickly by adjusting infusion rates along with IV antihistamines, and he has not had them since. Even with this life-saving treatment, and Dakota continuing to grow and hit milestones, Pompe has always still been there. Dakota would tire easily in the days leading up to his next infusion, and be super energetic afterwards. When he was younger, he would become moody and angry, and sometimes embarrassed that he had Pompe. I would just encourage him that he can have a wonderful life regardless of Pompe. He now gets weekly infusions of Lumizyme at home. Dakota is a happy, funny teenager that rarely complains even if he's sick, and has all but become numb to pain. Although Dakota can walk, he's not exempt from the emotional and physical issues that can occur with this debilitating disease. I hope that the incredible highs and devastating lows that our family has experienced leaves an impact that will help drive discussions and decisions to help new patients have better health and a future without the devastation that Pompe can cause a family. The story can change, and there's work left to do to get there. We've experienced firsthand the incredible change that is possible with newborn screening and treatment before muscle damage occurs, preventing progression of the disease and death. Thank you for listening to our story.
Wow, incredibly important statements. Just really, digging deep to talk really about the real issues of living with infantile and early Pompean life. I just really want to commend and thank our panelists for, working and being brave to, dig in and find those experiences to share with us. It's really important, and we hope that all of you that are following along live today will do so as well. So this is our first opportunity together today to hear from you that are following along live in the audience. Just as a reminder, this is our session on living with infantile and early onset Pompe. We'll have a separate session to follow this for those that are living with late onset Pompe. I want to start us on those first of the topics that I introduced before our panel, which is really understanding the symptoms and burdens that are most significantly impacting you and your child's life living with infantile and early onset Pompe, and trying to understand what those symptoms actually look like day in and day out. So I'd like to invite our infantile and early onset Pompe participants today that are following along live to, if you have something to share about impacts of this disease, to dial 1-703-844-3231. Again, that's 1-703-844-3231. We would love to hear from you and hear about some of the impacts that you've experienced in your life. We also have the option to write in with comments at that comment form that is located under the live stream on the PFDD webpage that you're on today. So you can go ahead and submit written comments at any time, and we'll be reading those as well. But to get us started in this discussion, you can see that we have some members of your community joining us live by Zoom as well. And I'd like to maybe start with Crystal and Haley to share with us some of the symptoms that have had a most significant impact on your life.
Hi, I'm Crystal.
Hi, I'm
Haley.
We're from Virginia. The most significant impact, I mean, that's definitely changed over the last 14 years. Initially, you're just trying to get by those hard winters, keep infections, respiratory infections out. And now just her symptoms are more physical. So low muscle tone, not being able to do your own activities of daily living, being like her peers, items like that just are the most significant for her at her time in her teenage life now.
Sure. And can you maybe give an example of, in daily life of how that represents kind of being the most burdensome thing now?
I think mainly just her not being able to walk around, go places with her friends at this time of her life where that's very important, the socialization. We try to do our best to, let her have those memories and perform them for her at times. But when there's times she can't go places or do things that her friends are doing because physically it's not able, that's at this point in time the most difficult.
Sure. And then is there an example of a kind of activity her friends might be doing that she's not able to join in?
Maybe like I'm not able to get on the boat to go out on the lake as easily, or go somewhere that maybe has stairs and I'm not able to take my wheelchair inside of the place that they're going.
So going upstairs, things like that, or in school, like gym class. So she would just not attend gym class because, it would be difficult, or they'd have to adapt around her, abilities.
Absolutely. Well, thank you for both of you, Crystal and Haley, for kicking us off on that. We want to get everyone else in the audience thinking about this too. And so we're actually going to go to our first polling question of this session. If we can pull up our first symptom question, and this is for only our infantile and early onset patients and caregivers. We'll have separate polling questions for our late onset participants shortly. So here we want to know, again, you can go to your phone, you can open a new tab in your browser, go to that URL listed at the top, polev.com/Pompe. That's the same URL we used earlier, and you can keep that open all day and the questions will populate. So here we want to get an understanding of the different Pompe-related health effects that you or your loved one have had or have recently had. And here you can select all that apply. The options are difficulty gaining weight and failure to grow for A, B, muscle weakness, C, decreased muscle tone or hypotonia, D, enlarged liver, E, fatigue, F, breathing problems and shortness of breath, G, for lung infections, H, for feeding problems or difficulty swallowing, I, hearing problems, J, speech problems, K, heart defects, L, pain or morning headaches, M, for scoliosis or curvature of the spine, N, anxiety or depression, or O, some other infantile or early onset Pompe-related health effect that you or your loved one have had or had recently that is not listed in any of the above options. We'd love to know all of those that you or your loved one have had or currently have or have had recently, and please select all that apply. So as a reminder, same as with our last set of polling questions, anytime we see a question where our respondents can select more than one answer, we're seeing a percentage of the responses, not a percentage of people selecting that response. So again, this is like a ranking. So as it stands, the highest ranked, so most selected symptom or health effect that is experienced by our participants today that are living with infantile or early onset Pompe is B, muscle weakness. That's followed by decreased muscle tone or hypotonia and speech problems, closely followed by fatigue. We're also seeing fairly high proportions of our respondents selecting difficulty to gain weight or failure to grow, as well as hearing problems and feeding problems or difficulty swallowing. Although we're seeing almost all of our different health effects selected here as being experienced, the only ones not selected is the enlarged liver, And we do have some people reporting other, so we'd love to hear about those things that are both listed here, but of course things that also we haven't identified on this slide. So we'll encourage you to call and write in about those. If we can go to our second polling question. So here we have the list of those same Pompe-related health effects, but the difference is we want you to select the top 3 most troublesome health effects that you or your loved one have. So in thinking through that same list and where you selected everything that you have or your loved one has, now think about which ones have the greatest impact on them in their daily life or on you in your daily life. Same options: A, difficulty gaining weight or failure to grow; B, muscle weakness; C, decreased muscle tone or hypotonia; D, enlarged liver; E, fatigue; F, breathing problems or shortness of breath; G, lung infections; H, feeding problems or difficulty swallowing; I, hearing problems; J, speech problems; K, heart defects; L, pain or morning headaches; M, scoliosis; N, anxiety or depression; or O, again, some other health effect that you or your loved one has that is most troublesome to them or to you. Please select the top 3. I promise that these would make you do a little bit more thinking when we were doing those demographic questions earlier. This is certainly one of those questions. So while final results are trickling in, it definitely looks like the top selected most troublesome health effect for our infantile and early onset participants today is B, muscle weakness. After that, it's quite a drop off then to C with decreased muscle tone, and right behind that as number 3, speech problems. However, you're seeing quite a bit of different health effects that are being selected as a top 3 most troublesome, including gaining weight and failure to grow, fatigue, breathing and shortness of breath, and several others. Definitely, while in the first question we learned that there's quite a range of burden of this condition, there are certain symptoms that tend to be more burdensome than others. So with that, let's go back and extend this conversation to our audience. I want to again invite you to dial in by phone 1-703-844-3231. We'd love to hear from our patients and caregivers representing those with infantile and early onset Pompe. But how about we come back to our Zoom panel here? I'd love to hear from Melanie. When you were looking at that last polling question and had to pick, those top up to 3 most troublesome health effects, what did you pick, and can you tell us a little bit about why you picked that?
Sure. So my son, Riker, is 3 years old. He was diagnosed at 3.5 months old. So for infantile, that's actually a late diagnosis. So he's literally had every single one of those symptoms, but currently our most troublesome symptoms at this point is speech, hearing, and feeding. It all has to do with the mouth. He is unable to speak at all. The only word he says is mama, which is the best word. But he uses a little bit of sign language, and the feeding has also been really difficult. He does not have a G-tube, but he is unable to progress in his feeding. So we are still stuck on purees and soft foods, even at 3 years old. And we've been fighting for the last year to get him a speech device to help him with communication, because it's very difficult having a 3-year-old who cannot get his point or his needs across to his caregivers. So that's our main goal right now, is to get his communication needs met. He is walking right now. He can crawl. He can climb upstairs. So physically, he's doing okay. We just need help with his communication.
Yeah, no, thank you for sharing that. So if you're thinking about perhaps like a good day, what that looks like maybe versus a bad day, where do you see those differences? Do you see it in the feeding and speech, or is it maybe in some of those other things that he's able to do more of, where you see some variability, kind of from day to day?
Yeah, we see some variability. So our worst days have to do with feeding. He's able to do a little bit of sign language for communication, but introducing any type of new food with him is so anxiety producing for him, because for the first year of life, he really didn't, he was tube fed for a good portion because he was failure to thrive. And so he just didn't progress like a normal kid does with learning how to eat and progressing in their textures. So introducing any type of new food is just horrible for him. He starts crying. He doesn't want to try it. He throws it off the table. He just wants to get away from it. So we do have him in feeding therapy right now, and that's helping a little bit. Our good days are if he tries one new thing. Sure. That's a good day for us.
Absolutely. Yeah, well, thank you so much for kind of sharing those insights. It sounds like quite a struggle with the feeding and getting him to try things, but I'm glad there are those good days where he's willing to. So thank you for sharing that so much. Paul, I know we've have some written comments that have been coming in from our other live participants on symptoms. Mind sharing some of those?
Yeah, absolutely. And Melanie, you highlighted something that those who have written into us have been highlighting themselves, and that's anything that has to do with the mouth is difficult. We had several individuals talk about their children with infantile onset Pompe and how speech is difficult. We had one mother of a 4-year-old, another mother of a 7-year-old, both of whom have infantile onset Pompe, write in to talk about hypernasality and how the voice of their child can be very difficult to understand. And in social circumstances especially, you have a 7-year-old going to school, perhaps, you have a 4-year-old perhaps starting school as well. That can be very difficult. It impedes being able to be sociable with their peers. So speech really was quite highlighted in the comments that we've received for individuals with infantile onset Pompe.
Sure. Thank you, Paul. So thinking about maybe other things that beyond maybe things that involve the mouth that were a top 3 most burdensome, Paloma or Sarah, do either of you, something that maybe doesn't involve the mouth that was a top 3, either of you have select one of those when you were responding to that polling question? Yeah, Sarah, please go ahead.
We've got 2 infantile Pompe kids. Myra is 2 and Bruce is 9. I've got Dad over here. He's been clicking the buttons for me. But anxiety was probably our top one, but it is related to the mouth. So Bruce is 9. He's got the G-tube. We're fortunate to have that. But he's going to school. He doesn't want to go get his G-tube feedings. He wants to be with his friends and peers in the cafeteria doing, what they're doing. And then, like Melanie said, trying new foods is a disaster. But also, so that kind of portrays, it relays into the growth. He's just, he's appropriate weight. He's been the same steady dose of Lumizyme now for a long time, but just progressing the weight's been our biggest issue. And anxiety. Port accessing can be good days or bad days. Depends what day it is, but port accessing is really bad too.
Yeah. And are there those better days when it comes to anxiety, and what does that look like?
We've tried, all types of cognitive things. Bribery, as any parent will try. But really, aging has been the best thing for him. We did try we tried Xanax for a couple of times, and that seemed to help a little bit. We just couldn't get the timing right. You got to have it at that one exact moment for the height of it to work. So really, it's just been aging and just talking to him more about it, and just kind of our own little therapy session of why we need to do this and be a big brother for sister, and she's you. So.
Yeah. So would you say, when you say aging, you think you look back like 1 year, 2 years?
4.
4 years, yeah.
4 was our hard year. And 4 was our hard year. And we're, every once in a while, we see a little flashback and it's like, oh, crap. Myra's 2, and she's not quite come out of that toddler stage yet. So it'll be interesting how she's at times to hold down right now. But.
Sure. Yeah, well, thank you so much, Sarah. I want to, we've been talking about symptoms and health effects. Something very related to that, Haley actually kind of got us on that topic, which was great, which is actually understanding some of the activities, that we know that these symptoms and health effects, aren't just occurring in a vacuum, they're occurring in life. And so we know that they're necessarily then impacting your activities in life. And so for this next question that we want to pose to all of our audience members is to think about what specific activities that are important to you or to your loved one that they're not able to do at all or as fully because of your Pompe. And to start us off on that, we have a polling question for you. This is our third polling question of the session. So go ahead, pull out your phone, go back to that other tab that you might have open in your browser. This is for our infantile and early onset Pompe families. Go to pollev.com/Pompe. And here we want to understand what are the specific activities of daily life, again, that are important to you, that you are less able or unable to do because of you or your loved one's Pompe. And here we want you to select the top 3. So which activities would you say are most impacted, that you're least able to do, that are important to you? Your options are A, walking, B, exercising or participating in sports, C, traveling, D, other hobbies, E, self-care and self-feeding, F, social interaction and participation, G, attending school or having a job, H, sleeping or relaxing, or I, some other activities that aren't listed here on this as a response option for this question that is an important activity that you or your loved one are less able or unable to do because of their Pompe. Please select the top 3 most impacted important activities to you. We'll give you a few moments to think about this and get those responses in. All right, so while final responses are trickling in, and again, these are percentages of total responses that we're seeing, perhaps the one, although they're pretty close, but perhaps the top one is exercising and participation in sports, followed by a tier of 3 that includes walking, self-care and self-feeding, and social interaction and participation. And then maybe as the third kind of tier standing alone is attending school or having a job. But we're seeing that all the other activities that we've listed here are in some of your top 3, including traveling as well as other hobbies and sleeping or relaxing. And so we really want to encourage you to call in, write in, and let us know how these different activities are being impacted. Are you able to do them at all, or do you have to modify that activity and do it in a more limited way? Which symptoms are driving your need to not, be able to do this? So we'll encourage you to call in. You can do that again using the phone line. It's 1-703-844-3231. Again, that's 1-703-844-3231. But I'd like to start this question off with our Zoom panel again. We haven't yet heard from Paloma. So Paloma, when you were looking at that polling question and thinking about which activities are most limited that are important, could you tell us a little bit about what you selected, and importantly, why did you select that one as being a top impacted activity?
Actually, I only ended up picking one, the social interaction and participation. There's been a combination of a lot of perfect things that kind of happen for Vaughn to have the abilities and the life that he does have. But unfortunately, it seems to be that his biggest struggle, because of what we've talked about with the speech and things, is, his ability to connect with little people his age. We run a girls volleyball club, so he's used to being around like high school aged people, and high schoolers kind of have a tendency, because he's little and he's cute and he's just so outgoing about it, to really kind of focus and try and understand. whereas peers his age have a difficulty, and because it's different and difficult, they kind of just want to shy away and not understand what's going on. So that can be heart-wrenching on the playground and stuff, but we've been fortunate. He's done soccer. We've signed him up for T-ball. He's incredible. He gets out there and tries his best, and maybe he's not the most talented kid out there, but the fact that he's trying, I think, is always the important issue. So.
Yeah, and just to kind of make sure I understand, when you're talking about kind of that difficulty of relating or even interacting with his peers, what is really driving that?
I really just think it's the inability to understand what he is saying. So his speech therapists have worked a ton on, when we meet somebody new, we introduce ourselves. Hi, my name is Vaughn. Hi, what is your name? Do you want to play? Like, he's got these different greetings so he can kind of make those interactions a little easier, whether that's vocal or if you use the augmented communication device. But it seems like either way, it becomes uncomfortable for that little kid listener, as you can imagine. Little kids, they're used to what's normal, and what's normal for Vaughn certainly isn't normal for the masses. And so watching those interactions can be difficult, but we do what we can to let him have those interactions and kind of work to figure it out on his own, because there are certain situations he's going to have to be able to start managing on his own, even at 4. So we feel like that increases at least his confidence to go out and continue to try and build those interactions. And then hopefully, he'll keep building his own little community of friends that understand what he's trying to communicate.
Absolutely. Thank you, Paloma. And I know we had heard from Haley a little bit earlier about the impacts of mobility on being able to participate in some activities. Would love to hear what kinds of things we're hearing from the web.
Yeah, absolutely. We have heard from folks in the infantile onset Pompe community on challenges with fatigue, challenges with low muscle tone, all of these challenges resulting again in difficulties in socializing with peers in the playground or socializing with peers elsewhere. We had a mother of a child with infantile onset who says that her child goes to kindergarten, but she becomes more exhausted before her peers do and has to take naps during the day, has to recover her energy more during the day. And so it's more difficult to actually participate in the same activities that her peers are participating within kindergarten. We also heard about the fatigue, similar to perhaps the muscle weakness contributing to difficulty in participation in active, activities at that age at school. Of course, a lot of activities at that age at school are quite active. But again, the fatigue and the muscle tone contribute to just a challenge to keep up. And when it's that challenging to keep up, it can be very difficult to socialize and stay with peers within the infantile onset community. So in addition to the speech difficulties that were highlighted by Paloma, the fatigue difficulties also contribute to difficulty in socialization.
Absolutely. And I think that may have been some insight into why exercising and sports was selected as a top one, given that so many activities are driven by kind of physical activity when you're younger, even in school. So we have one last question for you on this topic for our infantile and early onset community members. Knowing that there's so much more in the future as your kids get older, we'd like to understand, a little bit about what fears or worries that you have, as you or your child gets older. Perhaps what are any particular capabilities that you're concerned about losing as you get older? I'd like to go back and start with our Zoom panel on this and ask Crystal and Haley if maybe you can get us started with, what is it that worries you most about the future?
About the future, I believe what worries me most right now, we know with Haley's not being able to walk and using a wheelchair, that's pretty stable. So, of course, as she gets older, college, higher grades, that's going to become more difficult with driving and being able to go off to college. And I know respiratory wise when she was younger, that was a big issue for us and has been very stable recently. But I think as she gets older, and if there is any progression, could her respiratory status get worse is very frightening.
Yeah, I like what she said, most of the stuff that I do in my life, I need help with, most of it anyway. Some little things I can do on my own, but not that much. So like a lot of times you think about, you may need a caregiver 24/7, you may need, for weekly infusions, you're gonna have to fit in your classes, and you're gonna have to fit in your 5-hour infusion during the day. Like, just trying to fit it all in, and like thinking I'm gonna need, someone by my side to help me, and I want to try to become more independent, and all of that. So.
No, very well said, Haley, and we hear you loud and clear. We want you to have that independence as well. I'd like to give, for our Zoom panel, Melanie, the last word, and then we'll see what comments we have coming in from the web.
Yeah, so we have a lot of fears for our son, or just concerns, I would say. Just in the short term, what does school look like for him? He's 3, he's unstable when he walks. Do we need a wheelchair? Do we need to make our house ADA accessible? Is he going to be able to go to normal school because he doesn't talk right now? And when is he going to talk? And then, along with what Haley was saying, what does the far out future look? Does he need a caregiver? Like, am I going to be able to carry him up the stairs when he gets 10 years older? There's a lot of concerns about the future and a lot of unknowns that we have right now. We're very hopeful for some new treatments that hopefully will stop any progression from his disease, and hopefully we won't need caregiving for 24 hours in his future. That's our true hope for him right now.
Absolutely. Thank you so much, Melanie. Paul, can you share anything that's come in on the web on this topic? Yeah,
we have gotten a few comments on worries for the future and anxiety. We had actually Katie write in from Lima, Peru. Katie, thanks for writing in all the way from Peru. And she has anxiety for herself, for how she's going to be able to continue to care for her young child with infantile onset Pompe disease. But also the anxiety and stress, and even PTSD for that matter, that the child themselves can experience. We heard from a mother of her child write in who said that due to all of the pokes and prods and medical interventions and forced going to clinic, every single week, that there's a lot of psychological impacts on the young child on that, because it can be difficult to understand just why that's all happening. So we've heard both from the perspective of a child, but also from a perspective of the parent, just how difficult the journey with IOPD can be.
Sure. So I want to thank all of our infantile and early onset families for sharing so much. We got a lot of web comments that came in, and of course thanks to our Zoom panelists who helped us by sharing their own experiences. We're now going to do the same, cover some of the same topics, but now with our late onset part of the community, try to understand some of those same things with regard to symptoms, activities in daily life, and worries for the future. And to do that, we're going to start off also with a panel of members from this part of the community. We have Sean, Vanessa, Monique, and Lucas. So I'll go ahead and turn it over to Sean to take it away with our first panel remarks.
Good morning. It's an honor to present my journey of living with late-onset Pompe disease with you. My name is Sean Dorr. I'm 30 years old, and I live in River Rouge, Michigan. Growing up, I never had any inclination that I was any different from others my age. I enjoyed living like a normal child and excelled at school. Gym class and physical activities, on the other hand, were not something I did very well at. Running slow, unable to climb the rope, or perform a sit-up were just some of the things that I couldn't do. It didn't alarm me because I didn't really plan on being an athlete. At the age of 12, I was diagnosed with type 1 diabetes. During my stay at the hospital, they ran blood labs and determined that my liver enzymes were highly elevated, quickly drew a lot of curiosity from physicians. They did a biopsy a year later in conjunction, but the results were inconclusive. My liver function remained stellar, but yet the elevated liver enzymes suggested some kind of underlying damage. The specialists were perplexed, but it went no further. Years later, my father, who's a carrier of Pompe disease, underwent treatment for acute Guillain-Barré syndrome. His neurologist noticed my father exhibited muscle damage, issues he hypothesized could be genetic and not just Guillain-Barré. He brought me in for testing, and a few diagnostic tests determined that I had elevated creatine kinase levels, among other numbers. So I soon underwent a muscle biopsy, but yet that too determined that inconclusiveness. 2 failed biopsies and no insight led me to believe that I might just never get a diagnosis for this unknown ailment that I had. Over the years, I'd seen various doctors seeking answers. One of the specialists I saw in 2012 cut me loose saying he couldn't further diagnose me, but I probably have some type of glycogen storage disease. So close and yet so far. After a half dozen specialties and a dozen years, in 2018, I was given a blood test for acid maltase deficiency by a new specialist. A few online searches about the test left me curious, confused, and in denial. I dismissed a lot of the symptoms of this Pompe disease the test would soon reveal until I came across a video of a patient talking about how he was relatively healthy, but he yet was unable to do a sit-up as well. My blood test soon came back with low enzyme activity, and the writing was on the wall. A genome sequencing thereafter gave me such a specific diagnosis of Pompe disease, 2 gene mutations expressed in a few letters. Armed with my diagnosis, I sought out a clinical trial for those who are naive to the standard of treatment. What we now have is the enzyme replacement therapy. Despite having too good of lung function, it introduced me to the geneticist I see today. I now have been undergoing treatment for 2 years, and I never thought the diagnosis that I looked and sought for so many years would be so serious and so severe. A diagnosis of a disease that minimally will severely limit my life enjoyment and has the high probability of killing me from complications. To go into detail about my diagnostic journey is a thought process that's straightforward and focused. However, the realm of living with the disease is a sudden mind rush of questions and uncertainty. To an extent, one can argue I've been asymptomatic. However, the line between asymptomatic and symptomatic is not well defined, as, for example, I've been unable to do a sit-up my entire life. And how much effort it takes me to breathe, walk, talk, run, the fatigue I deal with every day is a variable that's not really measured beyond self-reflection. Just how affected I am with Pompe is something I still struggle with. Beyond extreme symptoms of weakness or fatigue, in Likert scale questionnaires, the incidence or severity of symptoms is really hard to adequately measure. Less than a year after getting diagnosed, I enrolled in a firefighting academy, not only for the credential, but also to have a firm grasp of how affected I am with Pompe. I could compare my efforts to my cohorts around me to really see the reality of Pompe. The class was not only challenging physically, but mentally, and I struggled to do things expeditiously, oftentimes not able to do them, or slowly if I could. All while classmates stared and watched on as someone who looked so normal was struggling to do even what they saw as easy tasks. Today I can relate mobility and strength issues to the disease, and they still continue to progress despite being on enzyme replacement therapy. Picking things up off the floor, cleaning up oneself after the restroom, and breathing are just some of the things I continue to notice that are declining even from the point when I was diagnosed 2 years ago. To track progression, I must make time yearly to visit a half dozen specialists, from heart doctors to pulmonologists, many of whom have no idea what Pompe disease is or why I am even seeing them. I continue to be hopeful for better therapies to stop or slow the progression of this disease, and my body has continued to fight off current treatment, forcing me to be strapped down to an IV more than just on the biweekly Lumizyme dose. Finding the courage and time to devote to 4 immunosuppression drugs, forcing up to 3 infusions a week, has not been easy. Despite high antibodies and having allergic reactions to enzyme replacement therapy, I hope the drug's working to help slow a progression that seems to be speeding up since my diagnosis.
Hello everyone, I'm Vanessa O'Connell and I live just outside of Orlando, Florida. I have late onset Pompe disease. I showed some mild symptoms as a child, such as poor posture, gait abnormality, soft speech, and had trouble gaining and maintaining weight. These were written off as growing pains, and my parents were told that my hips and legs were growing faster than the rest of my body. Despite these indicators, I had a pretty normal childhood. I played football with my older brother, rode dirt bikes, played basketball, and ran track in high school. The defining awareness of my symptoms came after the birth of my second son in 2003. The above symptoms continued, but got progressively worse. I was experiencing trouble standing from a seated position. If on the floor, I couldn't get up without help. My hips felt as if they were totally numb when I tried to use them. My balance and core strength was greatly diminished, and I was having trouble bending over to pick things up. The gait abnormality grew worse, which caused trouble when trying to climb stairs. I was having a lot of foot and ankle pain, and I would become exhausted and wobbly just walking across a parking lot. My poor posture, which would later be defined as scoliosis, made it harder to stand or sit upright completely for an extended period of time. My speech became softer and somewhat slurred, and I began to have trouble swallowing and chewing thoroughly. I found that in a reclined position I could not get enough air. These things were very scary. I was working full-time in my chosen profession of real estate property management. It was extremely taxing, highly stressful, and most weeks ended up working between 50 and 60 hours. I thoroughly enjoyed my career and looked forward to the new challenges each day would bring. I had a plan for my life and for my future, but that was about to change. The worst symptom of my disease revealed itself as I started falling asleep constantly. This was while I was driving, working at the computer, trying to watch a movie, or attend church. I was also having morning headaches. I battled these symptoms until 2010 when I had a sleep study completed. The study revealed that I stopped breathing 28 times within the first hour. I was immediately placed on a BiPAP machine for nighttime ventilation and sent to a myriad of doctors to find out what was causing all of this. I went through extensive testing and a muscle biopsy before my illness was incorrectly diagnosed as some form of muscular dystrophy. While trying to figure out which type, I remained untreated and continued getting much weaker. I started to use a cane when walking and a manual wheelchair most of the time when leaving my home. I was depressed, and my general health was headed downhill. In November 2013, I saw a new doctor through the AMDA clinic. He said he hadn't met anyone with Pompe before, but he remembered the symptoms from medical school and thought that they fit. In January 2014, I was diagnosed with Pompe by a blood spot test and gene sequencing. I'm very grateful and extremely fortunate to have met him, and I started enzyme replacement therapy within 2 weeks of my diagnosis. In February 2019, I enrolled in a double-blinded clinical trial for a new enzyme replacement therapy. I'm now in the open-label continuation until it hopefully receives FDA approval. Pompe has stolen many things from me. I was forced to give up my job, my passion, my salary, and my independence. I went on full disability in June 2016. My breathing and diaphragm weakness has worsened, and I have to be plugged up to my BiPAP machine whenever I lie down to sleep, recline, or even just relax and read. My gait abnormality has caused the labrum muscle in my right hip socket to wear extremely thin. There are days when I can barely walk or put pressure on my hip or leg due to the soreness. The latest symptom is an impingement in my right shoulder from the scoliosis, which, although is painful, it also limits my range of motion above my head. I believe that we can't control what happens to us, but we can control how we respond to it. Preserving the physical capabilities I have remaining is very important to me. My goal is to stay strong until a better treatment or a cure for Pompe is found. I have gradually increased my physical activity since I retired, and I try to stay more in tune with my body. My current workout level is 6 to 7 days a week, 2 hours a day. I split between the gym and my home routine. I also attend a private yoga Pilates class twice a week, and I try to eat a fairly clean diet consisting mainly of high protein, fresh fruit, and vegetables. I also use a respiratory muscle strength training device 4 to 5 times a week. With the extra effort of my overall approach to treatment, my physical well-being has improved. I have confidence leaving the house without the manual wheelchair, and my balance has stabilized so I no longer need to walk with a cane. I now have more stamina, as well as improved strength in my upper body and legs. My depression has been replaced with a positive outlook. Thank you.
Hello, my name is Monique Griffin. I live in Central Florida and I'm 45 years old. and I was diagnosed with adult onset Pompe disease in January of 2010. That was after, it took me 11 years to get my diagnosis. I was diagnosed initially with inflammatory myopathy, and it seemed to fit, and I lived with that diagnosis for 10 years. After that, we started looking at my diagnosis again because it had been a decade, I was getting worse, and the medications had changed, a lot of things had changed in that 10 years. And so we looked into it, and it turned out I did not have inflammatory myopathy. And it took us another year of a lot of testing, a lot of going to different facilities around the country. And finally, it was the Mayo Clinic who diagnosed me with Pompe disease. So 3 muscle biopsies, countless blood tests, EMGs, all sorts of examinations, and finally, 11 years later, I was correctly diagnosed with Pompe disease. Living with it changed a lot, but it changed slowly. While I was growing up, I was really active, somewhat athletic in that, grew up in Southern California, so there was, a swimming pool in the backyard, I'd go swim at the beach, we'd go water skiing, go up to the mountains and go sledding and skiing. I was a competitive swimmer and a dancer and a gymnast and a golfer. Pretty much all growing up, all through high school, I was dancing a lot still, and taking private lessons and taking lessons in school. So I was pretty active. And so then in my mid-20s, when I started getting symptoms, and we first noticed that, it was weakening my muscles. Like I said, it slowed down bit by bit, and having to use a handrail or had trouble getting up from the stairs. But I continued to live my life to the fullest. I, went to college and grad school in the United Kingdom. I graduated and came back and was sent to China for a year for work. And then shortly thereafter, coming back from China is when I started to get a lot worse, a lot more quickly. And that's what led us down to trying to re-diagnose me, and I got the Pompe diagnosis. All the time I was still fairly active. I was just walking slower and stuff like that. But today I do need a mobility scooter full time. I can walk with a walker. I have to make sure that I have accessible accommodations when I travel, from everything from the hotel to curb cutouts to the car to get me from a train station or airport to the hotel. I have to call ahead, even here in the United States, to shops and restaurants in some of the more rural places to make sure they're accessible. My home bathroom has had to be modified. Back when I was living in Europe, my friends and I would just look at a map, point at a place, and hey, let's go to Venice this weekend. We throw a backpack on, get on a train or a plane and just go. Nowadays, it takes planning and phone calls and assurances. And no doubt when I get there, there's always something that goes wrong, that something's not quite as accessible as it was in, say, the brochure or who I talked to. So my life has changed a lot. I'm obviously not competing on a balance beam and competitive swimming. And giving up some independence and swallowing my pride and having to ask for help, for simple things, even just doing laundry or preparing meals. I used to live very independently on my own for a long time. Again, I lived overseas by myself. So asking for help was a new skill set for me. I have groceries delivered. Like I said, I need help with some chores around the house, but the biggest obstacle is managing my energy levels. I just don't seem to have enough. So it's just like, well, what am I going to do today? What do I need to accomplish this week? Okay, so do I take a shower tonight and get some rest? Do I take one in the morning? How many errands do I have to run? How much energy am I going to have? And I really have to kind of ration what I can do with my energy and really time management and plan my days efficiently. So that's how my life has changed. It's changed dramatically, but it's just another way of looking at stuff. Thank you for listening.
Hello, my name is Lucas Garrett, and I'm here with you today because I was asked to share my story of living with Pompe. As we know, this meeting, originally slated to be 4 months ago, was delayed due to COVID. In that time, what I wrote needed to be updated. Originally, I was in the midst of combating my disease in a way I never had to before. Last summer, for the first time in my life, I had started to get weaker. I was diagnosed with Pompe at 5 months with a muscle biopsy. I've lived with this thing my whole entire life. While I've always known life, I'm a vet, as well as use a wheelchair. Getting weaker than what I've already known to be my normal was a special new level of health. My legs were getting weaker, and my arms were starting to feel more worn out than usual. Daily tasks, such as exercises, and certain aspects of my work as a musician, guitarist, and singer, had gotten harder, but not impossible. Sometimes shows lasted 3 to 4 hours. I really started feeling that 4th hour. Then in March, with the help of Dr. Kishnani, Dr. Cunningham, my primary, and my mother, I was approved to receive 40 milligrams per kilogram of ERT every week instead of biweekly. I am beyond pleased to note that I am continuing to thrive on this new dose. I am by far the strongest I've been in years. However, my life is still understandably impacted by Pompe disease. On any given day, I need assistance with most aspects of daily living, including keeping my airway clear. What impacts me the most, however, is the unknown. Most people deal with the concept of mortality, but this weight is especially heavy on me. The life expectancy for someone in my situation is unknown to the scientific community. Despair is a waste of my time, though. I am extremely fortunate to be able to utilize available treatments to stave off the elephant in the room. For the last 16 years, I've been on ERT. I also exercise at least 4 to 5 times a week and try to limit my carbs to maintain my strength. The regimen is long, exhausting, and grueling. It's worth it. No hospitalizations, only elective surgeries, and a prolonged lifespan. I've built a strong team of family and medical staff to help me meet this thing. Seeing as how a doctor told my parents I'd be dead before I turned 1, and I'm almost 27, I'd say I'm doing pretty damn good. Pompe is brutal, debilitating, and it will beat you to your knees if you live it. But it has given me the mental strength to thrive, despite Pompe's challenges. I graduated magna cum laude with a Bachelor of Science in Applied Mathematics, and used this degree to help tutor students in various subject matters in science and math. As a musician, I played out regularly, averaging 20 to 30 shows a year. And I'm currently working on releasing my 3rd album. I've even been asked personally to run for state assembly of all things. The point is not to brag, but to outline the life someone who was supposed to be dead 25 years ago has left. I don't live with Pompe. I live in spite of it. People are wanting to get in the doldrums over their disease. I get it. Believe me, I do. I'd like new treatment options. I'd love a cure. It would allow me to truly pursue my calling, performing and making music. But, if I'm honest, Pompe has made me who I am. And to deny that would be disingenuous. Music is my main motivator in life. It's my North Star. And it keeps me going through all the madness. Thank you for inviting me today, and thank you for your time.
Thank you so much. That was really special, giving us those glimpses into your lives. And again, so incredible for you to be able to share with us the things that are having the greatest impacts in your lives because of Pompe. So thank you to all of our panelists who shared their stories and took the time to develop those and record those to be shared today. So like our earlier session, we're going to spend some time now with our late onset part of the community to focus on some of the symptoms and health effects that are having the greatest impacts on you and in your lives. And so to start us off there, we'd like to go to our polling questions on the topic. If we can go to our first session 2 polling question, you'll recognize these questions from the earlier session, but here we want those of you with late onset Pompe, or if you're a caregiver of someone with late onset Pompe, to please respond to these polling questions. Again, you can, if you weren't able to join us earlier, you can just open a browser on your phone, open a new tab in your browser on the PC, on the computer that you're using, and type in pollev.com/Pompe. It's that URL listed at the top of the slide, and you'll be able to follow along for the rest of the polling questions today. So our question for you, so for our late onset community, which of the following Pompe-related health effects do you or your loved one have or have recently had? And again, we want you to select for this first one all that apply. So select all of the health effects that you have or have recently had. Your options are A, difficulty gaining weight or failure to grow, B, muscle weakness, C, decreased muscle tone or hypotonia, D, enlarged liver, E, fatigue, F, breathing problems or shortness of breath, G, lung infections, H, feeding problems or difficulty swallowing, I, hearing problems, J, speech problems, K, heart defects, L, pain or morning headaches, M, scoliosis or curvature of the spine, N, anxiety or depression, or O, some other Pompe-related health effect that you or your loved one have or have recently had that is not listed on this slide. And again, please select all that you either currently have or have recently had, so we can get a sense from our participants, of what the different experiences you have to share today. So we'll give you a few more moments to get your responses in here. As it stands, it looks like the top Pompe-related health effect that's being reported, again, these are percentages of responses, not of people, is B, muscle weakness, followed by fatigue, and then we're seeing, maybe a cluster after that of breathing problems, shortness of breath, decreased muscle tone or hypotonia, and pain or morning headaches as maybe the next kind of third tier. But we are seeing every single symptom and health effect that's on this list being selected by our participants today, and including some others, which we would really love to hear about in our phone callers and written comments. So if we can go to our second question, which is the same set of response options. But here we want to understand what are the top 3 most troublesome Pompe-related health effects that you or your loved one have. And so this, again, is for our late onset community, our patients and caregivers. Please select what you view as the 3 most troublesome aspects of Pompe for you or for your loved one. Again, the response options are A, difficulty gaining weight or failure to grow, B, muscle weakness, C, decreased muscle tone or hypotonia, D, enlarged liver, E, fatigue, F, breathing problems, shortness of breath, G, lung infections, H, feeding problems or difficulty swallowing, I, hearing problems, J, speech problems, K, heart defects, L, morning headaches or pain, M, scoliosis or curvature of the spine, N, anxiety and depression, or O, some other Pompe-related health effect that you or your loved one with late onset Pompe have that is most troublesome but is not listed on this slide. Again, we want you to kind of really think about this, pick up to 3 of the top most troublesome health-related aspects of your Pompe.
And James, I think what we're seeing here, and as we heard from some of our panelists as well, really all the challenges that come about with being active, with getting around, with completing tasks. No surprise to see muscle weakness pretty far out in front here. But because of the muscle weakness, it can cause fatigue, it can cause breathing problems, and just it all kind of piles up to be a challenge in being active. And I think that's coming across quite evidently in this data.
Absolutely. That muscle weakness really being the top rated most troublesome aspect, but it could be that, as you said, related to other these aspects. We're seeing fatigue and those breathing problems and shortness of breath kind of as a second tier, top most burdensome. And then a number of others. There's only a few here that aren't selected as for at least some people, the most troublesome thing for them. And so we really want to hear from you and understand why you selected, whether it was muscle weakness or fatigue or maybe something less common like speech problems or lung infections. Understand why it is you feel that's most troublesome in your life. Help us understand that a little bit more. And to do that, you can, we're going to broaden the discussion and invite you to call in, to write in. And so I want to remind you of how you can dial in for our late onset community to share your experiences. You can dial 1-703-844-3231. Again, that's 1-703-844-3231. We'd be very happy to hear your comments live today. You can also provide written comments using that little form that you'll find under the live stream on the PFDD webpage here today. So you can submit those, and as we have been throughout the program, we will be turning to read some of those periodically. However, to start us off on this first question of most bothersome or most troublesome symptoms, we have with us another Zoom panel, members of the late onset Pompe community. And so, we have an opportunity to hear from some of you, and perhaps we can start with Sandra. Sandra, when you were looking at that polling question, the most troublesome, up to 3 health effects, what popped out to you and what made you pick, the responses that you picked?
Well, one of them that I chose was fatigue. And it's interesting because yesterday I kind of had an epiphany. I never looked at fatigue being one of my symptoms, as weird as it sounds. I think because I'm just so used to being tired. So if you guys understand what I'm saying, I've kind of taken the attitude like that's just me. But then when I look outside of that, it's like, it's because of the Pompe. So, but I don't think about it that way. I just think about it as, it's me because I'm unique, just like everybody else. But, definitely from the Pompe. And lately, I've been having a lot of the morning headaches. Before they used to come and go, and now they're getting pretty consistent, like every day. I wake up, to the point where I feel nauseous.
Sure.
So, so those are the two, the fatigue, the headache, and what's the other one I chose? Muscle weakness, obviously.
Yeah, so really interesting what you're saying about fatigue. I'd like to probe on that a little bit more with you, if you don't mind. You say that you went from this epiphany yesterday that maybe it's actually is one of the most troublesome aspects, but before that you didn't even really think of it as a Pompe symptom. Is that because it's something that you've had your whole life? It's essentially just something that you've always had to deal with, and is it something that has gotten worse for you, or has it been pretty much your whole life you've had it?
No, not my whole life, but obviously I'm late onset. I didn't start having symptoms. I'm 57. Mm-hmm. So I didn't have symptoms just as far back as I can remember, was like my mid-30s, but still not knowing what it was then, because it took a long time to diagnose, just like, everybody else. But I guess when I say lately, mm-hmm. Like within the since I was diagnosed, how can I say it? So when I was diagnosed, even though they told me what it was and what the symptoms are, I just never looked at the fatigue as part of the Pompe. I just looked at it as, that's just me. And then, like I said, the epiphany was, damn it, it is the Pompe. What are you, this is not normal, but it's normal for me, if that makes sense.
No, that really does make sense. And I know that that's something that I've heard before, that kind of terminology of, my normal or my new normal or something like that. So, thank you for articulating that and sharing that with us, Sandra. On this same idea of symptoms and most burdensome symptoms, I thought we could go to maybe Morgan to hear from you. When you were looking at that polling question, what stood out to you? What kind of was the most troublesome thing? And I know, make sure we get you off mute there.
So what came out for me the most was muscle weakness. That for me, the amount of muscle I have, even with riding and it's tired after night, so around I have to take a break. If I ride a lot and get tired and fatigued, and my muscles are crying and had too much communication.
Sure.
And my breathing has like right now I'm trying to try for me because I actually touch my breath. And if you touch it, so I can cook. And then with my feet, well, I lost the ability to eat completely, see myself, and cannot really cause me to follow because I really my independence.
Sure. And I'm just curious, would you have said, even a few years ago, that those would be of the same top most troublesome symptoms for you, or would they have been different, a few years ago?
Maybe a little bit different, but not much.
Okay. Yeah, well, thank you so much, Morgan, for sharing. And, there's, so many different, we saw in those questions such a high burden of different symptoms and a wide range of things selected as most troublesome. And really, we know that today maybe it's your most troublesome, but maybe wasn't always. Paul, what are you hearing from our participants on the web?
Yeah, absolutely. Well, fatigue and muscle weakness were both covered by those who have been commenting. And I'll start with fatigue, where Sandra left off. We heard from both parents of children with juvenile onset Pompe disease, as well as individuals with late onset Pompe disease, comment on the fatigue that they have experienced. We had a mother of a son with juvenile onset who said that fatigue is huge, that he is always very tired, he sleeps many hours a day, and actually associated with the fatigue pain also helps to just wipe them out entirely. We had other individuals with late onset comment on fatigue, saying that I'm tired all the time. I wake up, I go to work, I come home, I go to bed. That's basically all the energy that she has. We also heard from other folks about just how exhausting Pompe is, that have trouble maintaining energy, and that actually it can cause falls. Because energy can be so low, the individuals can be so fatigued at time, a fall can occur from there. And we actually heard from an individual in Philadelphia who commented that they agree that there are a lot of low-level symptoms that they've had for a long time that they never realized were connected to Pompe. Sandra, that's exactly what you were saying there. But that's fatigue and gastrointestinal trouble, perhaps which we'll get to in a little bit, and falling are all three of those are examples of symptoms that perhaps they didn't realize were associated with Pompe disease, but because they've experienced them for a long time, that is something that has been prominent in their experience with Pompe.
Sure. Thank you, Paul, and thanks for everyone that's been writing in. I want to broaden this. Obviously, there's so many symptoms, we haven't covered them all, but as we're talking about these different symptoms, we also want to explore what are different activities in your life that are important to you that have been impacted by these different symptoms and health effects. And I want, if you have a thought on a symptom we haven't heard about yet, or maybe your own unique perspective on this, or you want to talk specifically about some activity, we'd love for you to call in. That number is 1-703-844-3231, 1-703-844-3231. But before we go to hear any specific responses, we want to get everyone thinking on this. So we're going to go to our polling question on this topic. So go ahead and pull out that phone, go to that other browser. It will have updated with this new question, which is about what specific activities of daily life are most important to you that you are less able or unable to do because of you or your loved one's Pompe. And here we want you to select the top 3. So what are the top 3 important activities that you are less able or unable to do because of Pompe? The options are A, walking, B, exercising or participating in sports, C, traveling, D, other hobbies, E, self-care and self-feeding, F, social interaction and participation, G, attending school or having a job, H, sleeping or relaxing, or I, some other activity that's important to you that you are less able or unable to do because of your Pompe that is not listed on this slide. So please think about this, think about the activities that are important to you, and which are the top 3 ones that you are less able or unable to do. I'll give you a few moments to think about this and get your responses in. All right. So while we have our kind of final results trickling in here, we see, again, these are percentages of responses. So our top kind of ranked response of most of activities that are a top activity that's impacted by Pompe is walking, followed by exercising or participating in sports. After that, you kind of have a number that are kind of closely clustered together. That includes traveling, other hobbies, self-care and self-feeding, and social interaction and participation. But then we even see the others, including attending school or having a job, sleeping or relaxing, and even other activities that aren't listed here being impacted. So we really would love to hear from you about some of these activities and why you rated those as being ones that are the top ones that you are not able to do. Any examples that you might be able to share in your life that might help us understand that and what that looks like for you would be really important for us to hear. So we will now broaden this discussion. I'd like to go and start with our Zoom panel and ask if we can have Brian share maybe what your response was to this, what you were thinking when you selected your response on this polling question.
So for some of us who are late onset, where the symptoms have come on later in life, we've lost the ability to do stuff like, I used to ski, I used to body surf, used to go hiking, back in my 20s, and those things are long gone. And then just, now, I think it's hard to go out in society. Well, we used to be able to go out in society at least, because, you have trouble walking, steps are hard, getting out of chairs are hard. So folks may not want to go to the movies, they might not want to go out for dinner as much, just things like that, and going to sporting events where you got a row of seats you got to kind of climb through. All those things are harder to do now and take a toll on you.
Yeah, so you're really kind of describing, kind of ability to navigate physically, these different scenarios. Maybe is some part of that related to the ability to plan for it and uncertainty, or is it just purely the inability to do that when confronted?
Yeah, I think it's probably more you don't want to be the person that trips and falls, and get embarrassed, things like that. That's that is for me, at least, I guess.
Sure. I'd love to get a caregiver perspective on this, and we have Sabrina on our Zoom panel as well. Sabrina, what would you report as kind of the activities that are most impacted?
So my son was diagnosed when he was 12, showed signs at 8, so he was a juvenile onset, and now he's 24. And unlike Brian, he doesn't really have a point of reference because he really never had an opportunity to be involved in physical activities. But when he was 15, he had to have scoliosis surgery because his back muscles couldn't support the growth of his spine. And so because of that, he's very limited with his mobility. So it's not, he can walk, he can drive, he can do some basic things like this, but he can't, he's 24. So he wants to go, do paintballing with his friends, or he wants to go fishing, or he wants to go things that aren't necessarily super physically active, but just really typical young adult activities. And he can't without a struggle or without some assistance. So I think that would be the biggest, the most troublesome aspect for Zach.
Yeah, and can you give maybe like an example of a time in daily life where that, makes it difficult to do something that maybe is more routine or maybe is something that's specifically important to you and to him?
So, well, I mean, something as and it's not basic, but something like bicycle riding. Zach can't ride a bicycle because his core balance isn't strong enough. And so our family, we really decide all of our activities and travel and recreational plans around Zach, because we never, ever want him to feel like we're not getting to do something because of him. And we don't ever want him to feel excluded, because life just in and of itself excludes people with Pompe from enough things already. Mm-hmm. And so we don't want our family to make that worse. So something as he can do a hike, a simple hike on a paved road, something like that doesn't have too much of an incline. And so we just work really hard to make sure that our travel and our activities are really centered around his capabilities and not his limitations.
Sure. No, thank you so much, Sabrina, for sharing that and sharing your family's kind of story around that. I'd like to go now to a caller. We have Dave from California with late onset, or representing someone with late onset Pompe. We'd love to hear your perspectives on this conversation that we're having. Dave, are you with us?
Yes, I am, and I'm a caregiver. My wife has Pompe, late onset, and tying into the most recent comment on taking someone hiking and what they can do and focusing on capacity, not the lack of capacity. Most of the dialogue today has been on the limitations and the downside. There has been little dialogue on, what are the learnings. what's the positivity of the journey? I was asked by your querist, or I was queried, and an example I brought up is people have talked about fatigue. And I know in our experience, what we've done is say, where do we really want to spend the energy? So we find ourselves spending more time on what's truly important and less time on what's not.
And what's, can you give me an example of that, Dave? You know, that kind of that, you know, deciding on what to, you know, with the fatigue, what are you able to do, and maybe what are the things that you trade off?
Well, it's not, again, I'm the caregiver, I'm not the patient. My wife's the patient. What we find ourselves doing in choosing where we spend our time and who we spend our time with, making better choices.
I see. Great. Well, I really appreciate you calling in, and I really appreciate the comment that you made on, you know, kind of the focus on downsides. You know, we're really, you know, it is a difficult thing that we ask to try to focus a bit on that, you know, because what we're hoping is to, you know, inform new product development that can help address some of those challenges. So we do want to try to understand.
My experience has been that most of the Pompe patient meetings are all spent on the science and the potential breakthroughs, and very little time is spent on how the patient or the loved ones are managing the journey, and what are they learning from that, and what gives them a good tired at night versus a bad tired. Absolutely. So I was reacting to the continual bias towards the science and the downside, and not how do you best cope and live with it.
That's right. Yeah. Really thank you for that. And just, you know, want to say, you know, we recognize that this is a different type of meeting, and you know, there is a reason to the types of questions we're asking, and you know, really, you know, I don't want anyone to think that we don't think that hope and recognize that this is not a community that perseveres and really, you know, it pushes through and is able to do so much. I mean, we saw that in many of the comments from our panelists, for example. You know, Lucas, you know, ending our panel talking about, you know, his getting to participate and make music, and that is really important, and it is important to understand what you can do in addition to any limitations as well. So I'd like to go on this topic of activities that are impacted and see what our web writers are saying.
Yeah, absolutely. Well, physical activities was really the most prominent challenge that individuals wanted to identify when it comes to impacts of Pompe on activities and on what one can do and what one can't. And Dave, something that you mentioned on really focusing on the important things, that comes across really loud and clear, because folks are also commenting on that as well. We heard from Lucas on that. We heard from Monique as well, really being able to focus on what's most important with the energy that an individual with Pompe has. We've heard from Kimberly out of Marion, Iowa. She says that maintaining enough strength for sit to stand is one of the challenges for her when it comes to physical activities. And that if she is able to maintain that strength, that allows her to be mobile. And that's something that she really focuses on, as she's also thinking about how to actually approach treatment for Pompe as well. On the juvenile onset Pompe side of things, we had a mother of a child with juvenile onset Pompe write in to say that that they are slower than their peers, and that fatigue is certainly an issue. And they're starting soccer this fall, and they want to be able to keep up with their peers. But again, physical activity can be a challenge in doing so. But still, they're starting soccer nonetheless. We've heard from other folks in the late onset Pompe community saying that a physical activity of actually raising their hands above their head can be a challenge. One mother wrote in to say that her daughter assists her with blow drying her hair, because it's otherwise difficult to raise her arms above her head to be able to actually blow dry her hair. But with the assistance from her daughter, she's still able to do so. So there's all sorts of physical activities that individuals are writing in about that are impacted by Pompe, and it can be, it really runs the gamut from what we're seeing in the comments here.
Absolutely. Thank you, and thank you to everyone that has been writing in. Want to cover one last question with you with some of the time that we have left, which is, looking, towards the future. Perhaps any worries or fears that you have as you get older. We know that you've experienced a lot, things in the past, things currently, but is there anything that worries you or you have fears about as you get older? Are there any capabilities that you're most concerned about potentially losing as you grow older? And so, to get us started off on this, I'd love to ask our Zoom panelist, Sean, who you heard from a little bit earlier, maybe talk about some of those worries and fears.
Certainly, the future is uncertain with Pompe, just because, as we've seen, the progressive nature affects everybody differently. That's perhaps what's really troubling, is we don't know individually how we're going to be in 10 years, 20 years, how long we're going to live, how we're going to be affected. Constantly something on my mind, and I kind of see living for the present rather than the future, because the future is so unknown. That's kind of like why I bought an old ambulance. I've turned into an RV. I want to go and see the world while I can know that I have the ability to do the things I need to do to maintain it, fix it up. And
right.
I think it really brings importance to mental health. I know a lot of patients really say that the mental health aspect of Pompe is often unmet, because, either we bring it to the forefront or we put it in the back of our mind is, what does the future hold? What is 10 or 20 years out? Am I going to be in a wheelchair? Am I going to need, assisted ventilation? And, there's no easy answer.
Sure. And on that point, because we didn't talk a lot about the mental health aspect, Sean, and so I'm really glad you bring that up. In your experience, is this something that kind of develops over time, over years, or is it come and go? I'd really just like to understand where that how this kind of manifests for yourself, and I know you're really involved in the community, so maybe others that who have struggled with some of those issues.
Yeah, so I've been diagnosed for 2 years, and it really hit home for me when I watched that video on the internet when I was doing the blood test, looking at Pompe, just kind of shedding tears, like wow, I have this, and it's always kind of there. But I always try to just be positive and look at the positive aspects. To touch on what Dave called in and said, I can sit here with this disease and let it take over and say, wow, my life's horrible and why couldn't it be like so-and-so? But I'd rather, do what I can and change the world, develop better treatments, have advocacy, share my story of Pompe, because it's something to be proud about. It's something that we all deal with, and we have to deal with it. And why not be proud of it? Why let it consume us? So,
sure.
That's how I see it.
Thank you so much, Sean. Thank you for sharing that on behalf of so many. So I want to kind of give the last word for our Zoom panel, at least, to Coburn, who is there with Morgan as a family member. Would love to hear your thoughts on, as you're sitting next to Morgan, what are you worried about for the future? Is there anything specific you'd like to share?
For the future, so Morgan's unique in that our days are characterized by what we can do to help Morgan. So I guess in the future, specifically just, assisting her, feeding her, taking care of her, and bringing her places are something that we, look forward to spending time with Morgan. I guess looking towards the future, I would like to have that ability to keep doing those things with her. Yeah.
No, that makes a lot of sense, Coburn. And That's very, very sweet of you, because there's so much that you experience in life, with your family members, and to be able to continue doing that, really, hits home to me. So I want to thank all of our Zoom panelists for their participation in this session. I want to give the final word on this session before we go to a break and come back to talk about treatments to those of you that have written in. So Paul, can you, share anything that we've heard on worries and fears for the future?
Absolutely. We've heard from several individuals of concerns that they have, anxieties they have about living with Pompe currently, as well as their anxieties for the future. Vanessa in Florida wrote in to say that she's very concerned about not being able to breathe as she gets older. We have Kevin from England who wrote in to say that he avoids speaking in meetings and sometimes avoids social circumstances due to psychological problems from speech problems. Due to early in life not having a diagnosis, all of this contributes to anxieties of social circumstances and speaking up for himself. We also heard from an individual with a late onset Pompe, who said he's anxious, he's worried, he's stressed about potentially leaving his family, about the effect that Pompe disease could have if he does pass away from Pompe, that it could have on his family. Finally, we heard from one additional individual on anxieties about being able to continue to walk, to breathe independent and without assistance from their children. This is Carolyn in Cleveland, Ohio. Carolyn, thank you for writing in. So you can hear that there are anxieties and stresses and worries for many in the community about what they may be able to do both currently, but also what they may be able to do later on as well.
Absolutely. Thank you so much, Paul. And again, thank you so much for everybody that has been writing in with these comments. Really important to hear your voices. We're going to go ahead and take a 10-minute break. We're going to come back at 2:55 p.m. Eastern Time, and we will pick up there and build on this conversation now that we've explored a lot of the burdens and impacts that you've experienced, and understand now some of the approaches to treatment, and importantly, what you're looking for from future treatments. So we'll be back in about 10 minutes. Thanks so much.
Welcome back, everyone, and we are excited to start the second half of our meeting, this time focused on current and future treatment options for Pompe disease. But before we get started into that discussion, I first want to welcome Tiffany House, President and CEO of the Acid Maltase Deficiency Association, to say a few words. Tiffany?
Hi, I'd like to thank Paul and the MTA for inviting me to introduce this session and for allowing me to help in some of this planning. Paul already introduced me, so I'll skip that part and simply say that I'm honored to be here because I'm passionate about making sure that the patient voice is heard throughout the drug development process. I've had the privilege of serving as a patient advocate for the FDA at several meetings over the years, both for Pompe and other rare diseases. I've seen the dedication of many of the FDA to learning from and listening to patients. My first experience with the FDA was in February 2006 when I attended a meeting between patient organizations and a team that was reviewing an ERT for Pompe that was later approved. What struck me about the meeting was how important it was for patients to be able to have a voice in the review process. As those living with the disease, those who are the most affected by the FDA's decisions, we have a unique perspective. I remember being impressed with how open the team was and listening to our thoughts and concerns, and that first impression has not changed. I want to take a moment and thank the FDA representatives who are participating today for attending, listening, and learning from our community. In the audience, we also have many industry representatives who are showing their dedication to incorporating the patient voice into their programs. And of course, the representatives from the expert community who never fail to show their support for patients. One of the things I am most proud of in regards to the Pompe community is the way that the entire community works together. It's something we call the Pompe model. The main stakeholders in the Pompe model are the patient community, the scientific medical community, regulatory authorities like the FDA, and industry. Each one has a unique perspective, but all need to be heard. For instance, while the other stakeholders, they understand the causes of our disease, the mechanics of it, they can't know what it's like to live with it. They can't know what matters the most to us, what symptoms we would most like to be rid of, what risks we are willing to take for new and better treatments, or our hopes for the future. As you saw and heard earlier, and we'll see in this session also, while there are common themes, there are also different experiences across the disease spectrum. As difficult as it is for some of us to participate, to do justice to the community, we have to give as many diverse voices across the spectrum as possible. I hope we succeeded, and it is clear that Pompe is truly a spectrum disease with many strong and passionate voices eager to be heard. In this session, the goal is to help the FDA and industry to understand the patient perspective on current and future treatments, including our thoughts on clinical trial design. These are incredibly important topics, and I am hopeful that we all walk away from the meeting today with a renewed understanding of the challenges the Pompe community faces, our desires for future therapies, but most importantly, our hope for the future. As you will hear throughout the session, those hopes will also vary. The needs and desires of a parent for their infant child that is diagnosed for newborn screening will invariably be different from an adult who is recently diagnosed with late onset. And both skills will be different from their patient diagnosed with full treatment and on the very severe end of the spectrum. And that's okay. That's as it should be. As someone who was diagnosed in 1995, I am proudly excited that with developments at newborn screening, our current treatment on the market, and many new treatments on the horizon, newly diagnosed patients today do not have to experience the same things my family and many others did. We are learning more and more all of the time. And as we learn more, we must continue to work together to put the lessons learned to the best possible use for the entire community. As a community, as the Pompe model, we have achieved great things by working together. My hope for the future is that with conversations and meetings like this continue, that we continue to work together and learn from each other, that we continue to do what may seem impossible. And AMDA's motto is a quote by Robert H. Goddard. It is difficult to say what is impossible, for the dreams of yesterday are the hopes of today and the reality of tomorrow. Please listen to the hopes and dreams of everyone during the session so that we can work together to make them a reality. Thank you.
Well, thank you so much, Tiffany, and we're so grateful for your partnership in putting today's meeting together. We truly could not have done it without you. So thank you for the partnership and thank you for the comments. Next, we'd like to welcome in Dr. Barry Byrne, Director of the Powell Gene Therapy Center at the University of Florida, as well as the Chief Medical Advisor to the Muscular Dystrophy Association. Dr. Byrne is going to give us an overview of the current and future treatment landscape for Pompe disease. Dr. Byrne?
Thanks very much, Paul. And I'm delighted to be here both on behalf of the MDA and to present this brief overview of some of the most important aspects that I think patients do pay key attention to, because this is where the future lies and where hope is derived for the patient community. So let's go on to the next slide. So we know that there are many factors that contribute to success in drug development. And as you can see, the best foundation for this is among the patients and families that are living with the disease. And then the patient organizations, including the AMDA, the UPF, and the MDA, to support those patients. And then be prepared, the patient community, to participate in clinical trials. And this is really one of the most thoughtless acts that people have in volunteering their time and effort in this endeavor. And certainly early diagnosis is particularly important in the Pompe community, as we've learned from the discussions throughout today about the diagnostic journey that many patients face and the advent of newborn screening, in which all patients will be identified in infancy. So if we go on to the next slide, I just wanted to give some fundamental background to amplify the need for new and innovative therapies. And what these are now being considered as advanced medical therapeutics that the FDA has paid a lot of attention to over the most recent years, because of the molecular basis of a number of rare diseases is known. There's now an opportunity to specifically intervene at the cause of the problem. And glycogen storage is the primary pathology in Pompe disease, in both early onset and late onset disease. And this is due to a lack of the ability of cells to degrade glycogen. If you go on to the next slide, this sugar, complex sugar called glycogen, becomes stored in the lysosome, and alpha-glucosidase, or human GAA, it needs to wind up in that compartment in order to have an impact. So it's made in a part of the cell where it acquires some unique features called the mannose-6-phosphate receptor. And those glycans traffic the protein to the lysosome in a very specific way. That same trafficking can lead to some of the protein being excreted, and also the basis for enzyme replacement therapy, some of that protein reaching the mannose-6-phosphate receptor and trafficking back into the cell in a recovery mechanism that leads, shown here, to the late endosome, transport vesicle, and then the lysosome. So on this slide, there are really two of the basic principles for the therapeutic options that exist for Pompe. One is the ability of the cell to internalize the protein when presented from the outside, and the other is the ability for protein made within the cell, in some cases I'll describe later, to be secreted, to be available to other cells in the body, like muscle cells, or for a cell in itself to be corrected through gene transfer, and I'll explain that in a few minutes at the end. So if you go on to the next slide. The first principle that was enabled in the case of a number of lysosomal storage diseases is enzyme replacement therapy. So next slide. And the most transformative aspect of this was first seen in the early onset form. As Dr. Kishnani mentioned in the earliest session, the cardiac effects of glycogen accumulation are responsible for the severe and early mortality in this disease. And the treatment studies with Lumazyme demonstrated that there really can be a dramatic impact on heart function, and that would lead to improved survival. And as she mentioned, if you go on to the next slide, all patients after 1 year of treatment had survived. Then with extended follow-up, we see that a subset actually went on later times to either not survive for some of the reasons that were described earlier, or develop dependence on assisted ventilation, much as the hallmark of the late onset disease. And you can see that even half of patients have a need for some form of ventilatory assistance in this early onset group. The next slide. This improvement in respiratory function was one of the key aspects of the approval of Lumizyme, but the improvement in walk distance of 25 meters or of a reduction in the decline of breathing function or vital capacity is something that has helped stabilize the patients who are receiving Lumizyme now since its approval in 2006. So that's an important milestone for the Pompe community to have some treatment available. But there's still more to be gained, and we'll discuss that in a minute. So next slide. This really important look at 396, almost 400 patients with late onset Pompe disease from the Pompe registry helped illuminate the fact that patients in all groups, whether they have low function or high function at baseline, are relatively stable on enzyme replacement therapy. There are two interpretations of this. Obviously, one is that this is afforded by the treatment, which they were all on during this observation. What is challenging, though, is none of the patients actually improved. They just have a lessened rate of decline, and you can see over this very long period that the rate of decline is not very great. So one has to wonder, are there other improvements that can be achieved, especially those that start off with very low function, as in the group in the purple on your right. So the next slide we'll go on to just talk about some of the efforts at enzyme replacement therapy. So there was a study done by BioMarin to try to develop a improved targeted enzyme that was found to be safe, but ultimately the goals of that sponsor were to find a drug which was superior to Lumizyme. And for that and a variety of reasons, that this clinical development wasn't continued. So that's always a disappointment to not have options where there was an expectation from the non-clinical studies this might be improved. You can go on to the next slide. Now there is an additional advanced enzyme replacement therapy with a unique strategy of adding those targeting moieties to potentially replace Lumizyme as a therapy called neo-GAA or alpha-glucosidase. This has also been shown to be safe, and there's a lot of effort now to advance through the final stages of pivotal studies that may make this available to a wider group of patients. Next slide, is a further enhancement of this idea of enzyme replacement therapy by, again, adding a unique ligand to the outside of the protein. This protein is called ATB200. An aspect of this effort by Amicus is to add a chaperone which facilitates the stabilization and successful trafficking of the protein into the lysosome. And this has been very encouraging results by looking at the enhanced pharmacokinetics of this protein. The next slide. Most important aspect of that is how, at least in non-clinical studies, this achieved something that was not seen before. It's a unique feature of Pompe muscle cells is that they accumulate some debris within the cell that inhibits their contraction and alters their function. And ATGAA seemed to have an improvement in the ability to reverse autophagy within the muscle cell. Next slide. So now I'll go quickly through the gene therapy strategies. This has obviously been an important advance in genetically defined diseases because the work over really the past 20 years in developing these therapies is finally yielding some results that are really encouraging to families and patients. Unique aspect of this is effectively when those genes are replaced within muscle cells or neurons, the effects are eventually permanent. So this is really a unique kind of treatment because it's given once in a lifetime, or there are now efforts underway to understand how to potentially re-administer these therapies over the lifespan to maximize the benefit. We know now that there are really some treatments that do slow progression of disease, but there's really a need to address the underlying genetic deficit. And of course, the challenges we face with enzyme replacement therapies, those proteins don't cross the barrier between the peripheral blood and the brain, and the CNS manifestations of the disease are not majorly affected by that or improved by that limitation. And of course, caregivers of Pompe patients, I think we'll hear on the panel, often report many additional problems, both financial, physical, and mental health issues around that we've heard a little bit about before, because the burden of treatment with weekly or alternate weekly treatment is significant. So this advent of a single dose therapy for adults or multi-dose therapy ultimately in the newborn diagnosed patients is going to be important. And that's going to be rely again on newborn screening. So next slide, I'll just run through quickly these options to consider. One concept is that the gene is replaced directly within the cells that need it the most. So those are the muscle cells, the heart, included in the heart in infantile onset Pompe disease, as well as the neurons that control those muscles. An alternative is shown on the opposite side of the slide, where cells from the body, stem cells, are harvested and corrected by a lentiviral vector, and that lentiviral vector corrected cell is then infused back into the body to spread the enzyme around into the various tissue compartments. And this is an approach being used currently by AvroBio, and I'll discuss that at the end. So if you move on to the next slide, this just gives you a brief animation of what happens when a gene therapy vector, in this case an AAV vector, one that was discovered here actually at the University of Florida 30 years ago, is able to be engineered to have a promoter which controls the gene. In this case, the gene will be alpha-glucosidase. It goes inside of this capsid shell or this protein shell by virtue of those inverted terminal repeats. When delivered into the bloodstream, this vector carries the functional gene to a muscle cell or a neuron, and that vector goes inside the cell, traffics like in the same way the protein does, ultimately, though, reaching the nucleus, where the instructions for making a new GAA gene are contained. And as long as that cell survives, those instructions continue to be expressed and restore the function from within the cell, or in the case of liver-directed gene therapy, that protein is secreted. So if we go on to the next slide, and this is the concept of liver-directed gene therapy. The human GAA gene put into an AAV vector is infused into the patient. It leads to changes within that liver cell, which are very long-lived, although it's important to say that they divide very dramatically in early life. So this is not an approach for infantile onset disease. And instead of the spikes and valleys that occur in this graph shown to the right, there's a constant expression of GAA. And this additional expression, as well as the potential for it to be expressed within the cell that's affected directly, has the greatest efficiency to replace the gene function and eliminate the glycogen storage. So there are two programs actively pursuing this now by Spark Therapeutics and AskBio. And if you go to the next slide, there's one additional program which has been presented at the World Lysosomal Storage Disease that uses another unique form of liver-directed gene therapy by retargeting the alpha-glucosidase to a unique receptor on muscle cells. And this looks to be a very efficient strategy being pursued by Regeneron. So the next slide is the lentiviral approach. So just to summarize, the work that was done to establish the proof of principle is to take stem cells from the body, correct them with the lentiviral vector, and put them back into, in this case, a recipient mouse. And then 4 months later, they followed these mice and found that there was extensive correction in the various important compartments of the body. And I believe this program is very near to entering the clinic. We've seen other uses of this therapy in blood diseases like sickle cell anemia and ADA deficiency, really one of the first diseases to ever be treated by gene therapy. And the next slide just shows that the heart and diaphragm were sufficiently corrected to get an impact on the function using this modified version of GAA. So that was encouraging to hear that at a recent meeting in May. So next slide. An initial thing we have to consider is whether the protein will be accepted. In the case of a good portion of the early onset patients have no or little residual protein. So this paper demonstrated that you could actually combine two gene therapy vectors in a way that promoted long-term acceptance of the protein and recovery of the function in all of the key tissues above this red line, which is the level of the wild type. So this is an important innovation in how gene therapy vectors can be combined to be maximally effective. So the next slide. Really just want to end here by thanking all the patients in the patient community. You heard the story earlier of George Fox, and this is his son Phoenix when he first came to us from South Florida. And then I'll just end lastly by saying thank you for the team that participates in these efforts. You see, it really takes a significant commitment by a great group of people who are committed to helping patients maximize their outcomes in life. So I'll end there. Thanks very much.
Well, thank you so much, Dr. Byrne. There certainly is a lot to be excited about in the future. And so let's dive into this a little bit further. Let's talk about our current and future treatment options. And for that, I'm going to turn it back over to James.
Thanks, Paul, and thanks both Tiffany and Dr. Byrne for that setup for this important session. So as was highlighted and previewed, this is our opportunity to build on that morning discussion around the direct effects of Pompe and now understand your views, your experiences, your perspectives on currently available treatments. We heard about those in our scientific presentations, including Dr. Byrne's. And so we want to really understand the patient experience with those. So we have a number of questions that will be, our panel will be speaking to, but we will also be asking you to speak to throughout. And so we're going to get an understanding of what approaches to treatment you have attempted or tried yourself or your loved one has if you're a caregiver. And that is really beyond not just prescription drugs, but also medical procedures, medical devices that you might use, whether that be for ventilation support or mobility assistance. But also more broadly, different types of treatments that you might try, whether that be more holistic approaches, things over the counter, supplements, and then even things like diet or exercise, or even modifications you might make in your own life just to make living with Pompe a little bit easier. We want to understand how those things have helped. So what has been the benefits you've experienced, and how has that impacted your daily life? How has your treatment regimen kind of varied over time, and why has that been? Once we kind of understand what you're using and how well it's worked, we understand that no treatment comes without some kind of trade-off. So we do want to explore what are the downsides of current treatments, whether that be side effects, the burden of needing to go to the hospital for treatment, or anything else that you might view as kind of a downside of a treatment. Once we've done that, we'll explore then some of your preferences around participating in clinical trials, as well as, very importantly, your preferences for a future treatment. Why we all would want a cure for Pompe. In the meantime, we want to understand, until we can achieve that, what would look like a meaningful benefit to you? What would you want or need to experience in your life to view a next treatment as being something that would be helpful or important or meaningful? And as part of that, we want you to consider, when you're describing how you would consider that new treatment, to explain any factors that are important to you. And so to help kick us off on this topic, again, we have a great panel. Here we are bringing the whole community together. So we're not focused on any particular type of onset. We want any and everybody to participate here. So we have a great panel made up of Dave, Haley, Crystal, Ryan, and Morgan, who are going to share their views and perspectives. Take it away, Dave.
Hi, my name is Dave Manger, and I'm from Chicago, Illinois. I'm the parent of a child with Pompe disease. My daughter's name is Caroline, and she's almost 2 years old. She is an amazing little girl that is full of personality. Caroline was flagged for Pompe disease through newborn screening in Illinois. Preliminary follow-up tests highlighted that Caroline had Pompe disease, and after several grueling weeks of waiting for the gene sequencing results, we were informed that she had late onset Pompe disease. While this was difficult news to receive, we took some comfort in the doctor's expectation that Caroline was unlikely to become symptomatic before age 3 to 5, and perhaps not until she was much older. Unfortunately, Caroline's form of the disease proved to be more aggressive than originally expected. Her biomarkers remained elevated and her physical development slowed. As we monitored Caroline's test results and hoped for improvement, we were torn on when to start the only approved drug treatment, Lumizyme. On the one hand, we considered the benefits of starting ERT, such as staying ahead of potential damage to her skeletal muscles, or even worse, her organs. On the other hand, we were making a lifetime commitment to ERT, and we did not want to put undue strain on Caroline by starting too early. We also had seen research suggesting the effectiveness of ERT diminished over time, so we were hesitant to start the treatment unnecessarily early. Caroline eventually made the decision for us when her biomarkers and physical development reached levels that more clearly demonstrated the need for treatment. We decided to start biweekly infusions of Lumizyme around her first birthday. It is our understanding she is one of the youngest patients with LOPD to start ERT. While some people may debate if we needed to start treatment so quickly, we never felt better about the decision than when we received the results from a biopsy demonstrating there was muscle damage in the first year of life, which contradicted the common view that people with LOPD are not subject to muscle damage this early in life. Early in our journey with Pompe disease, we enrolled Caroline in a clinical study at Duke University that is designed to develop a management approach for patients diagnosed with LOPD through newborn screening, helping reduce the uncertainty that families like us faced when deciding to start treatment. In obtaining the biopsy that demonstrated the muscle damage in the first year of life, researchers have been able to use Caroline's case to provide justification for newborn screening and starting treatment at the first sign of symptoms. We hope this helps improve the outcome for future patients. Caroline always looked like a healthy, happy baby on the outside, but Pompe disease delayed her overall growth, including her physical development, verbal development, and emotional development. In an attempt to reduce the development delays and supplement the medical treatment, Caroline undergoes physical therapy twice per week and previously speech and occupational therapy once per week alongside her mom. We also keep her on a low-sugar diet to the best of our ability, but this will become increasingly difficult as she sees children around her eating other food, specifically her older sister, who has a major sweet tooth. While we think these efforts have had a positive impact on Caroline, starting her on Lumizyme has had the biggest impact on her symptoms. We quickly noticed an improvement in her gross motor skills and curiosity. She went from being content sitting in one spot and observing the events around her to enjoying a newfound independence as she crawled around our house. We have even seen her biomarkers improve to normal levels. To further accelerate Caroline's physical development, we decided to double her dosage of Lumizyme in February. The progress has been nothing short of amazing. She now walks independently and is meeting milestones we once feared may not even be possible. Her verbal skills also improved significantly to the point where she no longer requires speech therapy and has plenty of opinions to share. While we could not be more excited about the progress Caroline has made in only a few short months, there remain opportunities for significant improvement in long-term outcomes and quality of life. ERT is one of the longest infusion treatments and requires IV access, making infusion days at the hospital long and grueling for both Caroline and Kate. In addition, clinical data shows a plateauing of muscle development after several years and a need for superior skeletal muscle targeting with the development of next-generation therapies. In considering clinical trials for Caroline, we will look for opportunities that provide an improvement over the standard of care for some combination of the following: the frequency and length of infusions, the drug delivery method, the targeting of skeletal muscles and the nervous system, and the ability to maintain adequate drug supply for patients enrolled in the study. We hold out hope that Caroline can benefit from future treatments that allow her to live as normal of a life physically as possible, which we hope includes running around chasing her big sister and sharing sweet treats. Thank you.
Hi, my name is Haley Haynes. I'm 14 years old and in the 9th grade. I'm from Gracie, Virginia. I have been getting treatment since I was 6 months old when I was diagnosed with infantile onset Pompe disease. The treatment that I get every week is viewpoints infusions, and it has some benefits and downsides to it. The benefit of this treatment is that I know during that time it's trying to infuse the bad stuff out and the good stuff in, and also trying to make me stronger and healthier. The downside of having to get this treatment is that every week I have to get a needle through my port, and sometimes I can feel the needle and it hurts. Also, I'm not able to do many things during the infusion time, like going places and moving and trying to move around in different positions. I do enjoy talking with my home infusion nurse though. Throughout my journey with Pompe, I have had to get OT, PT, and speech therapy. Some of these every few weeks, and at sometimes 2 to 3 times a week. As far as the therapies go, I like it and I don't like it at the same time. I like it because I know they can help me improve throughout daily life, and I don't like it because I have to take time out of my day for the therapy. The PT helps me become stronger and helps to loosen my tight muscles. Sometimes I'm a bit sore afterward from exercising. Currently, we travel every other week for an hour for PT that's just 45 minutes. When the travel time adds up to more than the actual appointment time itself, and also sometimes they work you really hard. I also have to eat higher protein and take vitamins every day. Sometimes it's hard to find food products with high protein in them, and it also means something you want to eat at the time. And it means something you like as well. When I eat foods with higher protein in them, I feel a lot of difference after a couple of days. Mainly healthier and better. Having Pompe disease can be difficult for school and friendships. Classes like gym, I'm unable to participate in most activities. As for my friendship, a lot of us keep in touch over the phone, which is easy. However, things like going to their house or a sleepover is very difficult and usually doesn't happen because of the physical care I need. For the future, if the treatment kept my muscle strength like it is today, I would be okay with that, because that's how I'm used to doing things. Ideally, the treatment that I would like to see happen would include finding a way to increase my muscle strength and finding a way for me to walk and not having to do therapy anymore. I would like to not do therapy anymore because I want to be like my friends and family who don't have to do it as I do. And it would also save lots of time in my day. If I get stronger and can do things on my own and can walk, etc., I don't really see a reason why I would still need to have these therapies. Another thing is a type of treatment that I wouldn't need to receive as often. As I get older, it will be harder to miss school or work for an all-day infusion each week. Since I've lived with Pompe disease my whole life, many of the things listed above are normal to me. So, I'll be excited for the future and see what new things come our way.
Hi, I'm Crystal Hayes, and you just heard my daughter Haley discussing a little bit about her journey with infantile onset Pompe disease. In 2006, at a few months of age, Haley was very colicky and hadn't been gaining weight. Her doctor at the time was keeping a watch on her weight, but eventually labs were done that came back concerning, and we were quickly sent to the hospital for further tests. In the next few weeks, we found out about her very sick and enlarged heart and the new diagnosis of Pompe disease. Over the years, treatment, or how we managed Pompe disease, involved a great deal of things. Initially, the obvious enzyme replacement infusion, but we found out soon after that Haley would need to be involved in seeing many specialists and also need many therapies to help her. She had to follow a special formula diet right away, and then soon after, she couldn't eat anything by mouth for risk of aspirating to her lungs. We fed her through a tube in her nose, then eventually a G-tube. That leads me to the many surgeries that was needed for different reasons. The one that I just mentioned for the G-tube, but also many surgeries for ports that would help infuse her life-saving infusion when an IV was not possible. She had a surgery to loosen tight muscles in her legs from where she was always sitting, not standing, with a recovery period that was extremely rough. Over time, there were many things that changed, but some that didn't. All of the specialist visits and therapies stayed about the same, although there are times she does them more often or less often. Surgeries have subsided a bit. However, port surgery is usually necessary every few years. She also got her G-tube removed in 2017, which was a great accomplishment. Things that didn't change, one was keeping a young child with low muscle tone and infantile Pompe disease healthy was an ongoing battle and almost full-time job. Winter and flu seasons or colds and viruses that were widespread throughout her school or community were very scary and even life-threatening at times. Around-the-clock monitoring, breathing treatments, oxygen, chest PT, cough assist, meds, etc. became normal to help prevent pneumonia or a worsening respiratory distress. Infusions changed somewhat over the years. She went from infusions of Myozyme every 2 weeks to enrolling in clinical trial for a weekly infusion, then increasing that dose. The 10-hour days and long drive every week seemed to be a decent trade for a possible chance of any clinical improvement. About 11 years after hospital infusions, home infusions became a reality. Many would think that it would be an easy switch, but it was a typical day in Haley's life to hang out and talk with her favorite nurses at the hospital and friends that she loved to visit while having her infusion. A few years after becoming best friends with her home infusion nurse, though, she wouldn't want things any other way. So much so that the last time we were asked to enroll in a clinical trial, we weighed the pros and cons and decided to decline at this time, mainly for fear that we would lose her nurse. In regards to clinical trials, going forward, it's going to be really difficult to determine which trials we would like Haley to be involved in, as well as which ones she would like to participate in. Many of them require lots of testing, appointments, and without knowing the expected benefit, how does one take their child that is fairly stable at the moment and try something different? If it's working for them, then it's hard to just try something different. How does a teenager or a young adult decide if more testing and appointments fit into their lifestyle at the time? I'm not sure what teen would say that it would. The drug or therapy would have to show great promise or allow for continuing of current treatment for it to be considered, or the chance to quickly switch back if necessary. If the benefit outweighed the travel, many appointments, and possible side effects, then we would possibly consider a clinical trial, and I assume Haley would feel the same way at this point in time. But of course, that's subject to change with the upcoming teen years ahead of us. I can think of several treatment or therapies that could possibly be ideal for those that hear the dreaded words, you or your child has Pompe disease, such as an easy cure with no future needs of any treatment or anything. However, in our particular situation, if there was a way to get the already damaged muscles working again, then that would help with many things, such as allowing Haley to walk or perform her own daily activities without relying on others. As we look into the future, we ultimately need to keep Haley's respiratory status stable or making sure it doesn't decline. During those hard winters, as I mentioned earlier, that can be a tough goal to achieve. Additionally, Haley will be an actual adult in just a few short years. Her being able to attend college, live on her own, or any of those things that turning into an adult type things that parents hate and love to see is what any parent wants for their kids. Ways that Haley cannot lose any independence or ways that she can actually have the ability to do more for herself would be ideal in regards to upcoming treatment. For her, it would have to involve muscle regeneration or additional equipment that can assist her. But with technology advancing the way it is, I feel that there is hope, just like I felt 14 years ago when she was first diagnosed.
Hello, my name is Lisa Schlein. I am 37 years old and from Fort Collins, Colorado. I am a veterinarian working on a PhD in cancer biology. My journey with Pompe disease began 2 years ago when I was about 4 months pregnant with my daughter. My husband and I had genetic testing done to look for another condition and ended up learning that I have 2 mutations consistent with late-onset Pompe disease. Initial follow-up tests came back as possibly consistent with Pompe. Genetic sequencing was done twice, just to be sure my first results were correct. The GAA enzyme levels in my white blood cells were a little low. I had some proximal muscle weakness. Was it Pompe, or was I just really out of shape? For the first several months after learning about my Pompe mutations, I was in a state of shock and denial. When I finally allowed myself to think about previous life experiences, I realized that I probably did have some subtle signs of Pompe. For example, as a child, I never could run very far in gym class, climb a tree, or climb a rope. During my pregnancy, I experienced profound fatigue that my doctors thought was abnormal. Stairs are hard and sometimes impossible at the end of a long day. We could argue that my fatigue and weakness are the result of a demanding career, but they seem a little atypical relative to peers with the same training and background. Lately, I've become more concerned about possible Pompe symptoms and will arrange for follow-up tests after the dust settles with SARS-CoV-2. In the meantime, I follow the nutrition and exercise guidelines I've been given to the best of my ability. When I first started, I could only do 10 to 15 minutes of exercise, and if I tried to do more, I would be in bed for 3 to 4 days recovering from fatigue and muscle pain. With time, dedication, and patience, I am now able to do 45 minutes of submaximal aerobic exercise daily and have been gradually increasing my daily step count. I eat a diet that is 25 to 35% protein, which is a challenge given that I would prefer to be a vegetarian. I'm now noticing that movement is easier and I'm waking feeling well rested. As a veterinarian, I place a premium on patient quality of life. A peek at my genetic code is a double-edged sword. I'm very grateful to have received the information about my mutations, and I can avoid the diagnostic odyssey that so many Pompe patients have had to face. At the same time, it's hard to make a decision about initiating treatment because I did not present with an obvious problem that needed immediate medical attention. Because my symptoms are relatively mild at this point, I'm not receiving enzyme replacement therapy or ERT. As I mentioned, I do have some concerns about worsening function, but due to SARS-CoV-2, many diagnostics that would aid in deciding whether now is the right time for ERT are on hold. From the outside, ERT seems frightening. There are many health conditions in which patients receive lengthy intravenous infusions of life-saving medications. But what makes ERT particularly daunting is that it's not just for a few days, weeks, or months. Infusions, once started, are a lifelong commitment, typically every other week, and they take many hours away from family and work. Additionally, many patients on forums talk about being completely exhausted following infusions, which increases the amount of downtime that might be needed following treatment. It seems that it is unknown what the ideal dose of traditional ERT is for many patients, or that needs increase over time. The benefit of ERT on improving skeletal muscle function is also quite variable, with some patients showing no improvement or a continued decline in function. While uncommon, the possibility of a life-threatening immune-mediated or allergic reaction to an infusion puts pause in my step as I weigh the benefits and risks of initiating ERT. From a patient perspective, an ideal therapy for Pompe would be one that is easily administered and is more effective. There are some very promising gene therapy trials that I am following with interest, and since I believe strongly in contributing to scientific discovery, I hope I'm able to participate in clinical trials. I am currently doing my best to understand Pompe and new and emerging therapies, and eagerly await the future of medicine for this disease. Thank you.
Hi, I'm Ryan Colburn from Los Angeles, California, and 5 years ago, at the age of 31, I was diagnosed with Pompe disease. My diagnosis via targeted sequencing served as the decisive piece of a nearly 3-decade-long puzzle. With it, so many things made sense, and it became clear that Pompe has been with me the whole time. Looking at my preschool graduation video from 1989, that was Pompe pushing off my leg to get up the stairs to the stage. Growing up playing hockey, it was Pompe that wore the fabric off the bottom of my glove that I'd used to push off the ice to get up. In '93, while investigating bladder control problems, that false diagnosis of hepatitis B and subsequent effort to find the cause of my elevated liver enzymes with liver biopsies in '96, '99, and '04. That was all Pompe. In January 2014, when I went to the doctor and convinced her that my lack of strength was more than masculine insecurity, she agreed to order a CK test. It came back high. Through the next year and a half, I had regular neurology appointments with multiple muscular dystrophies hypothesized, tested, and eliminated. I even had that inconclusive muscle biopsy that left me with a perpetual numb spot on my thigh. That's all been Pompe too. I'll show up on a natural history study as a data point that says LOPD hit in the 3rd decade of life. Having lived it firsthand and from sharing stories with friends in the community who were diagnosed later in life, I have a different perspective. I don't believe that Pompe waits to participate in our lives. Rather, our ability to listen isn't quite refined. We don't yet have enough of an understanding of Pompe that leads to a sensitivity to really detect the onset or progression of symptoms. In my case, they were talking for at least 26 years before we heard them. 5 minutes isn't enough time to describe my full 36 years of experience with Pompe, nor is it enough time to describe what excites me and scares me about the years I have left with a progressive neuromuscular disease. I hope that it's enough time to spark a discussion about how important it is to accelerate our ambitions and act with urgency. The future is super exciting to me. I made a cartoon to try to help explain why. These figures are based on US data given the regulatory scope of this agency, but the same concepts hold true for the worldwide Pompe community that we're representing. From this first one, the direction is clear. We have an increasing number of folks diagnosed every year. We have to do something. This second picture is the same data from the first, but with the impact of newborn screening added on top. For me, it represents a fundamental shift in our disease. On the left side, it represents the present. It represents the damage that has already occurred. And as that today line moves to the right, all of those people who I consider to be future me and future us, their treatment needs move from prevention to the harder problem of restoration. I find this data to be incredibly motivating because it screams opportunity. Each of us has a role to play in writing the next chapter of our rare disease story. I look forward to doing that together and have the following thoughts on how we bring that critical sense of urgency to keep this story from dragging on. We need to prioritize time and change the way we factor it into our decision making. Symptom progression can be more devastating than any AEs, however, the importance of this seems unrepresented in the risk equation. Speaking of time, since March when we were supposed to have this meeting, there have been 100 kids born with Pompe disease in the US. There will be 25 next month and 25 the month after. We're recruiting by the day, but our response is in years. We need to find ways to go faster. We need access to treatment while still in a preventive phase of our disease progression, and trial discussion and design that supports this. With each step in our process, we need to ask, how does this action specifically help someone to improved health? If the answer isn't clear, we should strive to eliminate it. We need to challenge our data to maximize learning. And if our data doesn't tell us enough, let's get better data. There's so much opportunity here with advances in technology and diagnosis rates. We should not restrict ourselves to doing something just because that's how it was done last time. In fact, that's the surest way to halt progress. Commitment to questionable measurements slows us down. We also need to be more inclusive. Our current approach to trials often excludes folks enthusiastic to participate. This limits properly evaluating efficacy of new approaches across the entire range of Pompe progression. We need to challenge ourselves to get the right data with the right sensitivity to improve our learning about Pompe and to understand when and how a new approach is working. In the next 3 years, we'll have diagnosed more people with Pompe disease in the US than ever have been. Each of them should have an opportunity, if they choose, to participate in changing their future. This shift in our culture, eliminating subjects and embracing collaborators, will serve us well. In doing so, we can rewrite the story of our disease and develop a new understanding that feeds back into helping those of us already living with it. Thank you.
My name is Brennan Williams. I live in Asheville, North Carolina. I am 24 years old. I have late onset Pompe disease. My story is different from those who were diagnosed with Pompe disease after enzyme replacement therapy became available. This is my mother here with me, and she will read the remainder of my speech.
I was diagnosed at 21 months when there was still much being learned to best treat Pompe disease. While waiting for treatment, I suffered significant muscle wasting and endured chronic fatigue and muscle pain. Much of my days were spent in bed. Initially, I was able to stand independently and walk for short distances. Eventually, I required a power chair for mobility. Tolerating solid foods became a challenge. I could no longer eat, so a feeding tube was inserted. My diaphragm weakened and scoliosis worsened. I became ventilator dependent at the age of 4. I was homeschooled, which was very isolating. In 2003, at age 7, I was one of the individuals accepted into the extended access clinical drug trial to receive Myozyme. I had a portacath inserted to start treatments. After receiving only approximately 7 or 8 infusions, my life changed for the better. I started public schools for the first time, 4th grade. Although I struggled academically and socially, I was thrilled to get out and make friends of my own. I was able to stay in my wheelchair for longer periods of time and began to tolerate solid foods again. For 2 days after treatment, I was fatigued, but on day 3, my energy levels improved. Before the end of the 2 weeks, however, between infusions, my energy levels depleted. In 2007, at age 11, Myozyme was approved by the FDA for treatment of Pompe disease. My family moved to North Carolina, and I was able to receive infusions at my home. Myozyme had slowed down the progression of my disease, allowing me to live my life the best way that I could. I am very thankful to those involved in creating this drug that gave me my life back. In 2012, at age 16, Genzyme modified the production process of Myozyme and released it in the United States under the new name Lumizyme. During the switch from Myozyme to Lumizyme, I had a minor allergic reaction at a nearby clinic. My heart started to race, I got dizzy, and my blood pressure dropped. My Asheville geneticist ordered Solumeldrol to stop the reaction. The reactions decreased with each infusion, and eventually they stopped. The commercially approved drug regimen seemed to be less effective for me over time. I could no longer lift a cup to my mouth and lost the ability to feed myself. My geneticists in Asheville and at Duke worked together to modify my treatments to suit the rapid progression of my disease by increasing the dose and changing the frequency from bi-weekly to weekly. For the next year, my body had to adjust to the increasing dose, which brought on many challenges, both physically and mentally. Having weekly infusions means that my energy levels are more consistent, but having weekly infusions is strenuous, to say the least. I am hopeful that the next generation of enzyme replacement therapies will remove more glycogen and allow damaged muscles to rejuvenate. Small changes, such as improving the method of drug administration, would make our enzyme levels more consistent over time, which would have a positive impact on the quality of life. It is imperative that new treatments are discovered and that more effective than the current drug, so myself and my fellow Pompe warriors can continue to live our lives and not decline. Unfortunately, I am not eligible to participate in clinical drug trials because I am wheelchair-bound and ventilator-dependent. The current requirements for the new trials eliminate those who would benefit the most from them. Therefore, I am a strong advocate for the importance of patients like myself with limited mobility and low pulmonary function to have access to new treatments as soon as possible. My life is a testimonial to how critical timely developments and treatments to people with chronic conditions. If I had received Myozyme a few years later, my life would have gone down a different path. I might not be here today speaking to you. Getting Myozyme when I did saved me from losing more independence and saved my life. I'm elated to be here on this panel today to advocate for future research and developments and to share my story on how treatments can impact the Pompe community. Thank you.
Wow, and thank you all for sharing your experiences and your hopes for the future. I think, as Tiffany House set this up, there has been quite a shift in the burden of the disease as a result of the therapies that are available to you. And our panelists did a great job of starting to describe what that has looked like for this community to have access to these therapies, but also to describe the important unmet needs that still exist and things that they would like improved upon for the future. And that's exactly what we want to do with all of you who have been sticking with us this afternoon and working through these really difficult but important topics. We have another Zoom panel of community members joining us. As I mentioned when I set up and introduced this session, we've brought in the discussion here. We're not focusing on any one onset type of Pompe. We want the entire community to participate. Although I do encourage you to remind us or let us know, what your onset type was, just so we have a little bit of context about your remarks when you're providing them. We're going to start off by talking about current treatments. So we want to start off by understanding what is it that you're currently doing to manage your Pompe symptoms and health effects, or if you're a caregiver, what is it that your loved one is using. And we want to get some assessment of how well those things are working. And again, treatments are really broadly defined here. We're talking about not just prescription drugs, although we do want your experiences with ERT and other treatments that you might have, say, for symptomatic relief. We also want to understand the real broad range, anything you might use in daily life, kind of holistically. If you have any thoughts about this, we're going to start off by talking about the things that treatments have worked in helping with. What are the significant symptoms that those treatments that you have available have worked to do, but we're going to work through these discussion questions. So if you have something to say about treatments, we'd love for you to join us by phone. That phone number, as a reminder, is 1-703-844-3231, 1-703-844-3231. And of course, you can also continue to write in using that form under the live stream on the webpage. But to get us all thinking about these treatment approaches, we have a couple of polling questions that we want to go to first. So if we can go to our first live polling question. If you've joined us, you didn't have a chance to participate in those earlier sessions. If you're a patient or a caregiver of an individual with Pompe, these questions are for you. We'd like you to take out your phone, open up a web browser, open up a new tab on your computer, and go to pollev.com/Pompe. You can see that listed at the top of the slide on your screen. This question that we have for all of you is, what medications or treatments have you used to manage your or your loved one's Pompe? And so here we want you to select all of those. We want to know all of the different experiences that you all have with different treatments. Your options are A, enzyme replacement therapy, B, pain medication, C, respiratory support, D, physical occupational therapy or massage, E, orthopedic or mobility assistance devices, F, surgery, G, high-calorie or protein diet, H, feeding tube, I, speech therapy, J, vitamins or supplements, K, cognitive or behavioral therapy, L, medical marijuana or CBD, M, experimental medications as part of a clinical trial, N, for antidepressants or anti-anxiety medications, or O, some other medicine or treatment that you have used to try to help manage you or your loved one's Pompe. Again, that can be, that's defined very holistically, so it can be anything that you've tried, maybe even a lifestyle modification that you've made to try to help manage your or your loved one's Pompe. We want to have you select all of those that you've tried or currently use. As a reminder, whenever we see questions that allow multiple responses, we're seeing the percentage of responses, not the percentages of individuals. So this is essentially ranking. So the experience as it stands, we've gotten a lot of results in so far. We'll please continue to put those in, but as it stands, it looks like the greatest experience within the community is with ERT. After that, it looks like we've got a second tier of physical and occupational therapy or massage, as well as vitamins or supplements, closely followed by a number of things, including a high-calorie or protein diet, pain medications, respiratory support, and orthopedic and mobility assistance devices. However, every single thing on here has been selected, so we've got a wide range of experiences. Less experience with things like cognitive or behavioral therapy or medical marijuana or CBD. A fair number of people reporting other things. So we really want to hear about that if you have an experience really with any of these things, but we would love to hear unique things. Give us a call at that number, 1-703-844-3231, or send in a written note. We love to hear lots of different experiences here. So thank you for participating in this. It gives us a good sense of the wide range of experience that is represented by our participants today. Could we go to our second polling question? So now we want you to think about, given all of those different things that you've used, in general, how much have those medications and treatments helped to manage you or your loved one's Pompe? Would you say A, no benefit at all, B, helped somewhat, C, helped a lot, D, very significant benefit, or E, if you're unsure? So please select the response option that best reflects your view on how much the medications and treatments that you've tried or your loved one have tried have helped to manage your or their Pompe. So we'll give you a little bit of time to think about this. There's a lot to consider. Looks like we're kind of in a dead heat here. Neck and neck, a little bit of dropping up and down, but getting kind of back at it with, really having these therapies having helped a lot, helped somewhat, or very significant benefit. So we're seeing a range, with, treatments, having, some amount of benefit, and we're seeing about proportionally equal amounts of different degrees of benefit. And we'll want to understand what that actually means to you, because this is, of course, a very subjective question. We want to understand your reasoning behind your selections. We do have some people responding that they're not sure, and that's understandable. And we also want to hear from those people to make sure, why is it that you're unsure? What was it that you were looking for that maybe you didn't see? All very important to this discussion. It's worth noting that nobody reported that they did not get any benefit from the treatment regimen that they use. So with that, let's dive into this discussion. So we want to understand here initially the different treatments that you've used and the different symptoms and other health effects of your Pompe that those have helped treat. So we're kind of starting with successes. We'll move to understanding downsides in a few minutes. So if you have a comment on this, we encourage you to call in 1-703-844-3231. You can also write in, but how about we start this conversation off with our panel. So I would love to go actually to Tiffany. So Tiffany, we heard from her earlier, but she was not a panelist, so she hasn't talked too much about her own experience. So I would love to hear from you, Tiffany, about your thoughts about current treatments and successes, and be as liberal as you want in defining treatments. We really want to know about the whole range of things people have tried. So go ahead, Tiffany.
Thanks. So I was diagnosed in 1995 at the age of 11. When I was diagnosed, I weighed 65 pounds. I had family members thinking that I had a eating disorder. I was so thin. So lots of diet was used at that point. Some to try to treat the Pompe, but some, frankly, to fatten me up. Just try to get some weight on me so that a cold couldn't potentially kill me. So diet was something we tried. It never made me feel better, but it got me the weight I needed to gain. And it got me to the point where treatment was available, and that saved my life. Other things I've done, when I was diagnosed, we found out my breathing was 40% normal. So clearly I went on a BiPAP right away, and as y'all see, I use it throughout the day to help me breathe at night, of course. I've tried supplements. I'm in a wheelchair now, so really the gamut of everything. Physical therapy, massage. I think I checked something like 10 boxes on that list. And I would say that everything to date has stabilized me for sure. I did gain strength back and stabilized at that point. My breathing before treatment had gotten down to 20%, so it's kind of still there. But with everything, combination of doing lots of different things, I'm stable enough to continue doing everything I need and want to do. But future treatments that help allow me to do more.
Yeah. So Tiffany, I want to probe a little bit. So you mentioned that you've been able to be stable. Have you needed to add things to your regimen in recent years in order to kind of continue and kind of reinforce that stability? Or has it been, I know you kind of alluded to this a little bit, so I just want to dig in on that a bit more.
Sure. Well, one thing is, and it's been mentioned several times today, dosing. I did have to definitely increase my dose. Mm-hmm. It's now weekly, and it's a higher dose. So that was definitely something that I had to do. And then I think as you go through different stages of life, your routine changes. So I've modified my routine to allow me to do the things during the day that I have to do. I think it was Monique that alluded to that earlier.
So what's an example of that?
So many things. You have to think about what you have to do today, tomorrow, throughout the week, and maybe do less today so you have the energy for tomorrow. And then if you know you're going to have a really busy day, be able to plan to go to sleep earlier, or at least get in bed in my case, and do less the next day. So it's all about thinking ahead. I think sometimes of planning your days like you're in the Army and you have to plan a campaign and think about all the strategies you're going to need to get through everything you have to do. It's not just, let's go to the movies. It's every element along the way. But
sure,
I've been doing it since I was 11, so it's just part of life now.
Sure, absolutely. Thank you, Tiffany. I'd love to go to George. We haven't heard from you on this topic yet, So I'd love to hear when you were looking at those, treatment options, and then that follow-up question on how well has it worked. What did you pick, and why did you pick it?
It's funny. I feel like you were watching me pick that there because I like Tiffany. I picked almost every one of the treatment options. There was, I feel like as Pompe folks, especially before there was a treatment, but as soon as we got an available treatment, you tried everything in the book, all the different amino acids and any holistic thing you would hear, you would try. If some sort of thread, or you would hear that people are, you didn't even have to know if there was success with it, only that somebody was trying it because you're grasping at everything.
Mm-hmm.
But then Lumazyme, Myozyme at the time came around, and we started getting an actual enzyme replacement therapy, but you still wanted to try to, add to that or, piggyback along with that because, it didn't seem like we were seeing the results that we wanted to. So one of the funny things that I did is that the second question was, what do you think? How are these treatments working? And I initially clicked, I said, I'm not sure. But in reality is that I didn't think about the enzyme replacement therapy because that saved my son's life. So then I went back and I switched my answer to, yes, it's made a tremendously big difference. But all of these subsequent smaller little things that we try every day, I don't really know. I don't know if they're working. Like he's not jumping out of his wheelchair and taking off. So I do a lot of things like after his infusion, one of the things that I've always done is I try to either get him in the bath or the pool where it's nice and warm and he can move. So I try to have him move his muscles as much as possible while the enzyme is in his bloodstream. Because I feel like there's this therapeutic window in there that I don't know how long it is. Maybe it's 24 hours, maybe it's only a couple of hours. But in that precious time, how do you use it? And so I've often done that. And like I said, I don't know if it's seeing results. I still do it to this day. Mm-hmm. He is getting a little bit weaker. He's been slowly getting weaker, but would he be getting weaker at a faster rate if I didn't do that? So, right. You kind of question these things, but it's kind of the trials and tribulations of living with Pompe and trying subsequent therapies. So, yeah. Yeah,
so lots to unpack there, George. I'm going to pause and just do a quick reminder if anyone wants to call in and add to this discussion. You can dial in at 1-703-844-3231. But George, two things that you said that were really interesting that I want to ask about. First is you talked about pre-ERT and you kind of tried a slew of things, amino acids. Was there would that fall like clearly into the not sure category, or would it actually be a no, it didn't help when you're thinking about that pre-ERT kind of regimen?
I think it's hard to qualify it, whether it helped or not. You don't really know, because you don't know what the natural course would have been. So you have nothing to compare it to.
Sure.
So in that case, I would say not sure. But it's still, there wasn't a lot of time for us pre-enzyme replacement therapy because Phoenix started his infusions when he was 8 months. But from the time he was 6 months to 8 months before we got diagnosed and he was declining, we were all over the internet, looking for everything possible. And that's when we tried, different amino acids and diets and all this other stuff. So yeah, it's a very real thing that I think everybody in the Pompe population has tried for sure.
So then my other question real quick for you is, you mentioned kind of your, going back and forth on the role of ERT and, how you would rate that. You mentioned that it helped a lot because it saved your son's life, but you also mentioned at one point that it didn't do all the things that you were hoping it would do or that you were looking for. Can you just give us an example of what that might have been, things that you were looking for that initially you said that, were thinking that ERT didn't give you what you wanted out of treatment?
Well, initially Phoenix's heart continued to get worse even after we started enzyme replacement therapy. But luckily, it was kind of scary because there was this sort of 2-month period that while he was getting the enzyme replacement therapy every 2 weeks, we were like, oh, it's not working. It's getting worse. But it was kind of like, the analogy stopping the train sort of a thing. So we had to sort of reverse the path of the disease process. And lo and behold, that takes more time than we're ready for, than we want to accept. But his heart then started to come around. And so that was great, but he continued to get decline from a respiratory standpoint. So when he was 3 years old, later down the road, he ended up getting like an aspiratic pneumonia, and then had to get intubated, and we couldn't successfully extubate him. So that was when we had to decide on giving him a trach or not. Right. And honestly, getting the trach was really one of the best decisions we've done, as far as making him stronger and happier and breathe better. He could gain weight, he could thrive. So, but yeah, we certainly wish, and I think that there is still plenty of opportunity with this disease to try to find better treatment that can target, these neurological deficits that are definitely there.
Yeah, thank you so much, George. You've given us so much there. I want to bring in some more voices here and ask Paul. I know we're getting some written comments coming in. Can you share some of those with us?
Yeah, absolutely. And we've received comments on virtually every single one of those options that we saw on that list. So there's a lot to go over, but I'm going to focus on just a few things first, and maybe we can get to some of the other ones later on in this section. But we've heard a lot about physical therapy and heard a lot about just staying active. Brian Martin in New York wrote to us that says that other respiratory muscle strength training and modified Pilates have been helpful to him as they help strengthen his core muscles and his shoulder muscles. We heard from other individuals in the late onset Pompe community. One individual says that PT has been very helpful because it has improved his gait, his walk, pretty tremendously, actually. Another person says that when they were doing physical therapy, they felt a lot better and felt a lot stronger. But they've had insurance difficulties in actually continuing to access that physical therapy. That actually was a bit of a common refrain. Another person said that PT and massage are great. They help keep the muscles flexible, but they might not be covered by insurance. So truly we see with physical therapy that staying active and having assistance and staying active in that way have really truly been impactful for individuals in the later onset Pompe community. One other thing I wanted to highlight, and these are some of these other treatment options that individuals are choosing to pursue, and vitamins and supplements were one of the higher items that we saw on the list there. And I'd love to hear more from our panelists about this in a moment, but we've heard from a number of individuals on albuterol. And Kristen from Phoenix, Arizona actually wrote in to say that she's heard about some folks taking albuterol and asking what the benefit could be for Pompe patients. She's interested, and other folks have cited albuterol as helpful. Someone says that they supplement their enzyme replacement therapy with albuterol sulfate daily. And then another individual with later onset Pompe says that they try to eat a high protein diet, but they also take B12 and albuterol pills and COQ and vitamin D, magnesium. They really try to supplement the enzyme replacement therapy with plenty of additional items. One final thing I wanted to mention before turning it back over, James, we've also heard about the diet. Mm-hmm. And we had Kevin write into us from England, and he says that a low-carb diet has been very helpful, as well as taking casein protein at night, but also stretching, indoor rowing, vibration therapy, walking, swimming before COVID, he says, all things that also contributed to helping to treat the disease.
Sure. Yeah, thank you, Paul, and thanks for everyone who's been covering so many of these different treatment approaches. Let's take a second to kind of broaden this. We still want to cover different treatments, but we also want to start to now understand what are some of the significant downsides that come with these treatments, and how do those downsides affect your life? We've heard from our panel that there's been some bothersome side effects, and there's been certainly some people started talking about burdens of needing to get treatment and frequency of treatment. We know that there's a lot to unpack there. So would be interested to start to understand any downsides that we've experienced. So actually, I'd like to maybe go to our Zoom panel here and ask Lucas. We haven't heard from him on this topic yet. Lucas, I'll keep it broad. Is there any treatment approach that you've tried that we haven't heard about yet, maybe that you want to share, or is there a treatment downside now that we're kind of starting to work into this topic that you would like to speak to?
I can't think of any treatment out there that you haven't covered thus far. I heard quite a lot of things and something I never heard of before. As far as the downside, I don't really, some people complain about how long it takes, but I'd rather be busy and alive than wide open and dead as far as my schedule goes.
Sure.
So,
and you're referring to ERT there?
ERT and, physical therapy and all the other stuff that we do.
Sure.
It's beyond worth it to me to do all that.
Sure. Anything else you would want to add when you were answering that polling question about how well your treatment regimen has worked for you? Any what kind of was the leading thing driving your decision on that?
Well, as far as the treatment goes, as others have noted, the enzyme, I've been on that for 16 years at various doses, and I forget how long I've been on 40 milligram per kilogram, but recently I went to every week instead of every other because it was no longer working as well. But since I've done that, I'm exercising more, and I'm exercising harder and doing more things. So, I mean, for me, I'm very fortunate that it's working well.
Yeah.
So,
Yeah, and when you say you're able to do more things, I know you covered some of that in your speech, but is there something specific that you're thinking of that treatment has enabled for you?
Well, I don't really want to bore everyone, but as a musician, on the guitar, you need to bend the string. And when you're bending a string, you're putting a lot of tension on your wrist. And I'm noticing that I'm doing that without even trying to do it now. So,
sure. Yeah.
Especially in my hands and my shoulders.
No.
I notice a big difference.
Oh, that's really helpful. Not boring at all, to know kind of specifically even just, at the hands and at the shoulder level that you've experienced
so I don't know what the exact, physics calculation, but I do know that when you're bending a string, you're having a lot of tension on that note. So
absolutely.
It obviously translates to more strength.
Great. Well, thank you, Lucas. I think, Tiffany, you had something you wanted to add to this conversation?
Sure. So one of the comments was about anything else that hasn't been mentioned yet. And a broad topic, there was discussion about pain management. I've used acupuncture for pain management in addition to massage, physiotherapy, etc., medication, and have received benefit from that as well.
Great. And so you're saying that was more for pain treatment. Could you characterize that, the benefit that you experienced?
I was having really bad sciatica at one point, and it resolved that issue. For me, sometimes being in a wheelchair all the time, I'll have flare-ups, especially in one of my hips. And it's one of those things that once I get it under control, then I can manage it again. But during the flare-up, something like acupuncture massage tend to help stop the cycle that I'm in and resolve the situation.
Wow, that's great. Yeah, thank you so much, Tiffany. I know we've been getting on that question since we've opened it up to talk about downsides. We have gotten some written comments on that. Paul, can you share those with us?
Yeah, that's right. We've had a few folks write in about downsides to the current treatment regimen that they're pursuing. As Lucas referenced, there are a handful of folks who cite the downsides of weekly or biweekly infusions, or every other week infusions of enzyme replacement therapy. Sean wrote into us, he's from Valley Stream, New York, that one trade-off of enzyme replacement therapies that he would have to say is making himself available every week for that infusion. It means that if he wants to take a vacation with his family, they can't go anywhere for too long because his infusion, or just make the decision of missing out on an infusion. So it's really a trade-off that they have to consider as they're considering traveling or just being away from home for a long amount of time. Some other individuals also cited other access challenges, including the cost of the therapy. Jenna from Illinois said that co-pays are outrageous, leaving them in a very difficult financial situation, and that echoes that are required for her child with Pompe disease, plus weekly PT, feeding therapy, and so forth, can cost well over $6,000 a year. And that is quite the burden to her family. As Catherine also talked about, she's from Eagle River, Alaska, insurance challenges in accessing therapy as well. And then finally, we've also had folks write in about concerns about plateauing on enzyme replacement therapy, or the potential lack of improvement, that they've been on it for a little while and that they feel that they're no longer improving, or perhaps that they might even be declining for that matter. And we did have someone write in, this is, pull up his comments specifically. John from Las Vegas, Nevada wrote in to say that enzyme replacement has been slowing the progression, but now he's worried that the Pompe is winning over. And that there are several other folks who have cited similar things, that the first 5 or 6 years on enzyme replacement therapy, that they could tell it was helping, but the last few years they've seen a progression in their weakness. So it appears for folks who have been on enzyme replacement therapy for a little while longer, that there, for some at the very least, there are some concerns about plateauing, or perhaps that enzyme replacement therapy not preventing the disease from progressing any further.
Sure. Yeah, thank you guys for everyone who has been writing in very insightful comments. But want to remind you, you don't have to be shy. You can share your voice live as well. We do have that phone line, 1-703-844-3231. Again, that's 1-703-844-3231. We'd love to hear from you and have a little discussion with you about your experiences. So now I'd like to, round out this conversation. We have a couple of Zoom panelists we haven't heard yet, and so I want to ask on this topic of downsides, what stands out to you? Maybe I'll start with Dave and then go to Lisa.
Certainly. I think in our case, I'm speaking on behalf of my daughter, Caroline, who's almost 2 years old. And for us, the biggest challenge is the frequency and the length of the infusion process. For Caroline and her mom, it's typically an all-day process that begins early in the morning and extends well into the afternoon, and even the next day in the case of Caroline, as she recovered from the infusion. And we're certainly fortunate to be near a great infusion center, but keeping a small child contained in a confined area for an entire day is certainly a challenge. So kind of the length and the duration of that infusion is a challenge. The other thing I would highlight is the drug delivery method. Like many people with Pompe disease, Caroline has been characterized as a tough stick when it comes to traditional IVs. That encouraged us to go the route of having a port installed, which has made the frequency much easier, but still accessing the port has its own challenges, and it has to be replaced every couple of years. So those are the two biggest challenges that I would highlight.
Sure. Thank you very much, Dave. Lisa?
Well, at this point, I haven't experienced too much in the way of Pompe therapy since I've primarily been focused on diet and exercise. But one of the things that was kind of a surprise downside was, I guess, kind of realizing the limits of what I could do with how far my Pompe has actually progressed in the short time since I've had my genetic diagnosis, and kind of learning my limits and learning how to exercise appropriately. As a barrier to starting treatment, I do echo the sentiments of several other panelists about the access to infusions, the amount of time that they take, and the drug delivery methods seeming onerous.
Sure. I really appreciate that, and someone who, is kind of in that, pre-ERT kind of phase, to share your views on it even before experiencing it. So, with that, there's a lot more we want to cover in this period of time that we have. Do a quick check with Paul. Anything else on this before we move on to clinical trials?
Yeah, just a few more thoughts on potential downsides to treatment that we haven't quite covered yet. And some include anxiety. that have to do with receiving the treatment. Actually, this is most prominent in the infantile onset Pompe. And I referenced it a little bit earlier, but for a 4-year-old with infantile onset Pompe, her mom wrote in and said her anxiety and PTSD is so high due to the amount of poking and prodding. All the medical appointments and therapies, weekly infusions, surgeries, hospital stays that she's gone through, that she looks for power in other daily situations. She looks for opportunities to really be able to take control, and that can lead to tantrums, that can lead to meltdowns, that can lead to other challenges in the household. And you know, that mother wasn't the only one to write in about anxiety due to taking the enzyme replacement therapy as often as their child had to. Another mother with a 4-year-old with juvenile onset Pompe said something similar, anxiety due to her trauma from medical interventions. So, you know, these were a handful of things that those, in especially the infantile onset community, wanted to emphasize. Over in the later onset community side of the discussion, we did actually hear some downsides on exercise. Interestingly enough, I would also say there's downsides on exercise, but you know, for one individual with later onset Pompe community, he said that physical therapy actually hasn't been helpful. In fact, he thought it might have actually hurt him even worse than it potentially helped him. And then another individual wrote in with late onset who said that when she has a great difficulty breathing, and she knows by breathing it could be causing more pain in the future, how does she exercise? How does she exercise muscles that continue to weaken, but the very exercising itself can cause pain? And it's a wicked cycle that she doesn't know how to break, which is how she characterized it. So a handful of other experiences in how individuals have been seeking to treat the Pompe, but that have some associated downsides with them.
Sure. Yes, thank you, Paul, and thank you again to those of you that wrote in. So we know in conditions where there is unmet need, and we've been starting to hear what that is from you, but also hope that there are the opportunity to have new therapies be developed to help treat and hopefully alleviate some of that burden. And the way that we are able to test those therapies to see if they do in fact have that benefit, but also to understand what the risks are, is through clinical trials. And so we know that this community is largely is not a stranger to clinical trials, but we have a couple of questions to understand that experience and your thoughts about that. So if we can go to our next polling questions. So go ahead and pull out that phone, back to that browser. You can look at see the URL to type in if you're not already there, polev.com/Pompe. We have some questions for you about clinical trials. So this question is, have you or your loved one ever tried to participate in a clinical trial for an experimental treatment for Pompe? And so the options are A, no, I was not informed of that opportunity to participate in a trial. B, no, I have not tried for other reasons. C, yes, I have enrolled in a trial. D, yes, I tried to enroll in a trial but did not qualify. E, yes, I tried to enroll, but enrollment was closed. F, yes, but did not want to enroll due to the burden of travel, the trial, like travel and potential risks. G, yes, but did not want to enroll for other reasons. Or H, you have received access to an experimental drug through something else like expanded access or compassionate use. So a lot of options there, but we want you to select that which best reflects your experience with clinical trials, whether you've tried to participate or not, and depending on that, which category best captures your clinical trial experience. So we'll give you some time to think about this. As it stands, it looks like we have some good or a great amount of experience here. Over 50%, just over 50% have enrolled in a trial. We see about a quarter of people saying that they didn't, but it was because they were not informed of one. About 10% of people saying no, they did not, but they did not try, and that was for other reasons other than not being informed. And we do see some experience with each of the other kind of yes categories. They tried to enroll but didn't qualify, tried to enroll but it was closed, tried to but ultimately chose not to because of the burden, and they tried to but they did not want to for other reasons. We don't have anyone reporting that they've accessed the experimental drug through expanded access or a compassionate use program. So lots of experience with clinical trials. Definitely want to hear about your thinking about enrolling, what you considered as part of that. And that actually takes us to our next polling question.
James, actually, if I could pause just for a second before moving forward, there is an option to actually choose multiple options for this one. I think up to 3 options on this one, I believe, because actually families or individuals could have experienced multiple of these. Perhaps they were able to enroll in one trial, but they were perhaps disqualified from another trial due to an exclusion criteria or some other thing that didn't allow them to participate in that trial. So if there are multiple experiences that you have that you kind of fit in any of these categories, please feel free to choose up to 3, as we know that you may not have just experienced one.
Great. So it looks like maybe people had figured that out because we don't see too much movement here.
There you go.
So thank you for everyone who answered this question. So if we can move to the next question. So regardless of whether or not you have actually participated in a clinical trial, we want to know about the factors that would influence your decision to participate in another study or maybe your first study. Those options, those factors, and you can pick up to 3 here that would be the most important factors to you, are A, how the treatment might improve your health, B, the promise to receiving open label therapy at the end of the study. So after you might have been on a placebo, that promise that you'll actually get the study drug when that period ends. C, reputation of the study's principal investigator, that's the doctor that is running the study. D, the proximity of the study site or amount of to you, or the amount of travel needed to get to the study site. E, the availability of safety data prior to enrolling. F, the concern over more common side effects of treatment, such as loss of appetite, tiredness, or nausea. G, concern over risks of serious side effects, things like cardiac or liver issues. H, the way that the treatments are administered, for example, whether it's orally versus intravenously. I, concern over the required hospitalization, doctor visits, etc. Or J, some other factor that would be important to influence your decision to participate in a clinical trial that is not listed on this slide, but would represent a top 3 factor for you. So again, think of those top up to 3 factors that would influence your decision to participate in a clinical trial. All right, so looks like final results are just trickling in. So as it stands, and again, these are percentages of responses. So the top rated factor is A, how the treatment might improve my health. So this the Pompe community represented today, wants to know how that treatments could improve their health, and have some opinions about what it is that they would want to potentially get from a therapy in order to enroll in a study. So we definitely want to hear from you about what it is that you were thinking when you selected that. After that, the kind of second tier is pretty far below that. Is things like concerns over serious side effects, proximity of the study site or amount of travel needed, or the promise to receive open label therapy at the end of the study, all very important to this community. Perhaps a third tier being things like availability of safety data prior to enrolling, and the reputation of the study's principal investigator. But everything on this list was a top 3 issue for at least part of this community. So really interested to hear and see why these were important to you. So let's broaden this discussion to our audience. I'll remind you that you can call in if you have want to talk about a treatment experience, or if you want to talk about clinical trial, your thoughts around participating. You can call in at 1-703 844-3231. And of course, you can write in as well. But let's go back to our Zoom panel here. If I can see our Zoom panel, I want to see, does anyone want to volunteer here to get us started on what it is that you would consider as important to participate in a clinical trial? Oh, I got Tiffany as our taker. Why don't you start us off, Tiffany?
Sure. So I think the biggest thing for me is something that I think would improve my condition. Like I said earlier, I feel like I'm more or less stable, and I know a lot of people, the routine of the infusions are a problem, but at this point I've been doing it for 20 years, so it's literally just a part of my life. So that doesn't concern me as much as something that would be an improvement on where I am today.
Sure. Thank you, Tiffany. And I think, Lucas, you have something you want to add as well to this idea of what is important in terms of participating in trials.
Okay, so I was 10 years old when I was first on ERT, and that was about 17 years ago. At the time, I wasn't really worried about the side effects. Now they've done ERT. They kind of know what they're doing with that, I'd say, of how well so many of us are doing. What I'm concerned about is gene therapy. I really want to make sure they know what they're doing before I decide to have something put in me like that,
And what would you be worried about if there was less information known?
When you're dealing with gene therapy, I'm not expert in the subject, but I did go to school for science. I would have a lot of concern over rewriting part of the DNA that they did not intend to do. And since gene therapy is in its nascent stages, and they won't really know what's going to happen long term.
Right.
Or if it might mutate after the fact. So I think we need to be really sure of what we're doing when we're dealing with genetic coding.
Sure. Yeah, thank you so much, Lucas, for sharing your perspectives on those, and specifically even gene therapy trials and your perspective on participating. We actually have a caller who wants to contribute his thoughts on participation in clinical trials. We have Ryan from Los Angeles. Ryan, are you with us?
Yeah, how's it going, guys?
Hey, Ryan, how are you?
Yeah, doing well.
So go ahead. We're very eager to hear what you have to say.
I'm sure. So when I think about the things that motivate me to consider a trial, one of the things that I think is really prominent is the opportunity to participate in advancing the state of knowledge about our disease and how to treat it. And so I think we by having a heavy participation and a bias towards participation, we learn in those trials, but then we also excite new research into it because we're showing that there's a fertile audience ready to collaborate with our talented team of researchers and doctors.
Sure. So really that what's driving you and interest in participating in trials is being able to contribute to the knowledge of disease, contribute to the knowledge of those therapies, for benefit not just of yourself, but really the full community.
Yeah, and recognition that whether it's a future version of myself or a different person coming into the community that's born tomorrow, that how do we take the 15-year outlook and bring it into 5 years or 10 years, as opposed to really only worrying about the step that's immediately in front of us, recognizing that each of these steps immediately in front of us are part of a bigger picture journey that we're all on together, and that we get there faster by all participating together.
Absolutely. Really appreciate you saying that, Ryan. I'm so glad that you called in. Thank you. So I know we've been getting a couple written comments in on this, so we'll turn it to Paul to share some of that.
Yeah, that's right. We've had a handful of individuals write in on their experiences with clinical trials, one of whom cited the benefit risk that they go through, the benefit risk calculation they go through when considering a new clinical trial. This individual with late onset Pompe said that they choose studies that could offer insight quickly or could benefit patients' daily struggles, but they don't want to do studies that involve biopsies, or they're also cautious towards phase 1 studies. So they want to be able to participate, but they do have some things that they consider before choosing to participate. And actually, we've seen other folks write in about wanting to participate in clinical trials, but they've been unable to due to exclusion criteria that prevents them from actually participating in clinical trials. We had one individual with juvenile onset Pompe write in to say that he has a heart condition from Pompe that excludes him from most studies. Another individual that says that they want to be able to participate in clinical trials today, but they're not naive to enzyme replacement therapy. They've been on enzyme replacement therapy, so there are current trials right now they wish they could participate in, but they're excluded from doing so. And then actually similar to what Lucas had to say, another individual who also expressed concern about gene therapy clinical trials, saying that this individual with late onset Pompe, that if they're in a phase 1 gene therapy clinical trial and that the dose is subtherapeutic, they're concerned then that the gene therapy could then prevent them from participating in a future clinical trial, and that actually wouldn't bring the benefit that they're hoping for. So all viewpoints on clinical trials, some of which again focus on wanting to participate but not being able to. Others focused on wanting to participate but then considering some of the reasons or other factors that could be involved with the clinical trial that might make them hesitant to do so.
Sure. So I know before we move on to our final question, a couple of our Zoom panelists have something to add. So why don't we start with George and then finish with Lisa?
Okay, great. Thank you. Yeah, no, I just wanted to add a little bit to the gene therapy topic. Phoenix actually participated in a gene therapy clinical trial. I want to say it was probably 6-7 years ago. I can understand why Lucas and other people would be apprehensive about gene therapy because of the science behind it and the sort of the technology. But at the same time, I would say that for me, it's the home run. I've always said it's the holy grail of treatment because the problem lies in our DNA, in our gene. And so everything else, to me, seems like just a Band-Aid. So really, you have to get to the root of the problem. In that case, it's the gene. So I think that there is so much good science happening right now. And in this industry, and even outside of the rare disease community, there is tremendous amount of gene therapy and clinical trials going on where there is some good safety data coming out. So I think that that's really important for us to see that safety data, which is emerging. I will echo the same sentiment about being in a gene therapy clinical trial because of that one that we were in. We could be omitted from future trials. It has since been brought to my attention that that can be investigator specific or sponsor specific, that if that's something that they're doing as an extra layer of safety that in the future they may remove. So it may not stay the way that it is now as far as if you're in a gene therapy trial, you're omitted from future gene therapy trials. That could very well change once we understand it a little bit better. But for me, in our disease in particular, I feel like it is really what we really need to treat this the way it needs to be treated.
Yes, absolutely. Thank you so much, George. And Lisa?
I think George stated beautifully that gene therapy has such tremendous potential for the treatment of Pompe disease. And it's a really exciting field and one that I would like to contribute to as a study participant if I have the opportunity to do so. And another point that I wanted to emphasize is that I think it's really important as patients of having a rare disease to really volunteer for opportunities that present themselves because they might advance our health, but then they also advance the field and help other people with Pompe disease and help the scientific community move forward as well. So I feel very strongly about being a participant in the scientific process.
Absolutely. Really great, and great to hear kind of that common theme from a number of people about participating in trials. So with that, let's go to our final discussion question, both of the session and of the day, which is starting to think about future treatments. So short of that cure, what specific things are you looking for from a next ideal treatment? And so to help us in thinking about that question, we have our last polling question for you, both of the session and again of the day. So thank you for your continued participation in this important meeting. So here we would like for you to rank as which would you rank as most important for a possible drug treatment to address today. You are able to select up to 5 options here. So while I'm sure we want many of these things, we were trying to whittle down and think about what, if you had to pick, would be the most important things to see from a possible drug treatment today. Your options are A, to reduce pain, B, reduce fatigue, C, improve lower body muscle strength, D, improve upper body muscle strength, E, improve respiratory pulmonary strength, F, improve speech or facial muscle strength, G, stabilize or slow further progression from the current state, H, reduce anxiety and depression, I, reduce time or effort spent on therapy administration, J, a less invasive route of administration, K, fewer side effects of therapies, or L, some other factor or some other important possible drug treatment that you would like to see from a future treatment that you would like addressed today that's not listed on this slide. And again, you can pick up to 3. We'll give you a little bit of time here to think about this. I know we're asking you to pick many important things, based off of what we've learned from you so far today. That many of the things listed on this slide are things experienced that by this community where you could use some help, but we want to know what are the most important ones you would like to see. We'll give you just a few more moments here to get this in. I want to remind you that if you want to speak to this topic of what it is that you would like to see from future treatment, that you can call in. You can dial into that phone number, 1-703-844-3231. This is your last chance today to have your voice heard by FDA and others. We will be collecting comments after the meeting, but to have your voice heard today, you can dial that number 1-703-844-3231 and tell us what is you think is most important for a next treatment to address. What factors are important to you? Based off this polling question, what we're seeing, again, these are percentages of responses. The top ranked most important possible drug treatment is to stabilize or slow the further progression from the current state. Close behind that is the desire to improve respiratory and pulmonary strength. And an essential tie with that is improving lower body muscle strength. In a third grouping, we're seeing the desire to improve upper body muscle strength, to reduce fatigue, and to reduce the time and effort spent on therapy administration. The only things that aren't a top 3 for any of our participants today is desire to reduce anxiety and depression or to see fewer side effects of therapies. Everything else is a top 3 most important possible drug treatment. So let's broaden that discussion here to our audience with the time that we have remaining. If we could go to our Zoom panel, I'd like to see who would like maybe to specifically speak to this question. I know I've called on you a little bit already. Maybe we can start off with Lucas.
Hi, thank you. Okay, really quick. I know I said a lot today, but I wanted to say when you have Pompe, you need to be pragmatic. And as hard as it might be, there's just no way, in my opinion, that you're going to get all of it back. So I think you need to be very goal-oriented. I've been in the wheelchair my whole life. I don't really think I'd never be walking again, or ever. So I think for me and the upper body, because of my work, it would just make everything a lot easier for me. Thank you.
Sure. So in thinking about that, and maybe not, something that's a large improvement, but, keeping, is there something that's most important to you, a particular capability or, other important kind of key function that you're thinking of?
I call myself one anyway. It depends who you ask. But
yeah, for you, Lucas.
If I would lose my upper body strength, I think that would be the most devastating blow for me, because it would completely forbid me from doing anything that I do work-wise. So,
Sure.
I'm going to do everything I can to make that not happen.
Absolutely. No, that from everything you shared with us, Lucas, I understand why you're saying that and really appreciate you sharing it. Want to, give others on our panel a chance here to speak, but also want to make one more pitch to anyone that might want to call in, 1-703-844-3231. Want to go to Lisa. I think you're in a unique position, given, where you are in your treatment journey. So very eager to hear, when you were answering that polling question, what was most important to you?
I think for me, one of the most important things for therapy is preserving pulmonary function, because that is tied in with so many things that one does, from, talking and being able to sleep comfortably, to being able to move and to exercise and to just enjoy everything about life. So for me, that's one of the daunting things about Pompe disease, is thinking about the loss of pulmonary function.
Absolutely. Thank you. So I know we've gotten some written comments on this. I want to make sure that we get to those, and then we're going to give Tiffany our last word as we're wrapping up here. So Paul, I know we've gotten several comments on this. Very eager to hear what they have to say.
Yeah, that's right. We have gotten several comments from individuals in the community on what they would prioritize in a new treatment. And actually, interestingly enough, it does differ from the polling results that we got, as actually the administration of the therapy was one of the common themes that we're seeing right now in those who are writing in about what they'd want in the future therapy. Sandra from Brownsville, Kentucky writes in that she just hopes something new will come out to treat Pompe because she is on weekly enzyme replacement treatments, and that she's exhausted. She's tired, and that she's been doing this for 8 years at this point. Others have written in about the frequency of administration of therapies. A parent of a child with infantile onset Pompe said that they would like for treatment to last longer so that they don't have to endure the weekly or biweekly infusions. And then similarly, Diane has written in to say something very similar. She says that, and she's from Westchester, New York, that what she wants is for a change of infusions to be monthly rather than biweekly. So just a little bit less often than they are currently. Ryan also wrote in, Ryan from Los Angeles, about wanting for enzyme replacement therapy for there to be an oral option for folks who are working on alternate treatment modalities, that an oral ERT with hope for an even more creative, less costly in time and invasiveness approach would be very helpful to him. So we've seen a lot on the administration of a therapy within our comments. But we've also seen others in desiring a reversal of symptoms. One individual with late onset Pompe said that they want that for a new drug to reverse the damage that has been done to their body. So while administration was one of the more common themes in the comments that we've received, some other folks that comment on reversal of symptoms, on the treatment, the enzyme replacement therapy not wearing off in its utility over time. So some other comments on those topics as well.
Sure. Thank you so much, Paul, and thank you for everyone that wrote in. So we're going to give the last word to Tiffany. Tiffany, I've known her for something like 12 years now, back from my FDA days, where she was a FDA patient representative. So, I'm really going to, put you on the spot and ask you, Tiffany, you've tried a lot. You've told us that. What specifically is it that you would want for something as an ideal treatment for you?
Oh, wow. Okay, so you are putting me on the spot because you know I don't like talking about myself. For me, I would love to have an improvement in my pulmonary. That would make a huge difference in my life. The wheelchair I've been in, since I was 16, so 21 years longer. I've been in it longer than I haven't. Mm-hmm. So that's, my normal at this point. Sure. Bad pulmonary is my normal, but it would absolutely make the biggest difference. And I think...
And when you say that, when you say it would make the biggest difference, what do you mean by that?
Being able to talk longer. I will say, and I wanted to mention this earlier, when we were talking about the different modifications and things that people use. One thing that made a huge difference in my life is when I let go of my pride, I suppose, and started using a wheelchair, which, as I mentioned, allowed me to have an expanded world. It was not as limited. Using the Trilogy bike pad during the day, and it's got a battery, so it's portable. I can take it wherever, made a difference. It gave me energy because I was no longer spending as much of my day fighting to breathe and wearing myself out. So you adapt, but having the improvement internally where you don't need to adapt, I think would be huge. But I think that strikes me the most is that, like I said in the introduction, what we want for the future really depends on the person and the patient and the family and where you are in the disease spectrum, where you are sometimes from diagnosis. I think, George, Lucas, and I have a different perspective than Lisa and Dave because of when we were diagnosed and where we are in the disease process. And I think that's why it's great to have all of our voices here today. And everybody's voice that has sent in a comment because we really are all different. Yes. And we all have our hopes that they are common, as you mentioned. Improvement. That's what we want. Stabilization first, and then improvement, and then an easier way to do it. Yeah. And we also definitely need better inclusion into clinical trials so that the more severe patients have a chance to participate, because otherwise we won't know how treatments work for the entire spectrum.
Sure. Beautifully said, Tiffany, and I think a perfect way to conclude the portion of the meeting where we're getting your input and kind of just move to some brief wrap-up. But I just want to thank all of you, our Zoom panelists. I want to thank everybody that's written in, the people who called in, our panelists who took the time to really, provide their statements. As your moderator, this has been an incredible, full afternoon of really understanding, all of those differences, but also all of those commonalities. And I can't stop thinking about Dave, who called and was saying, you're really asking us some tough questions. You're, asking us to, focus on some of the bad. And we knew that this was going to be a tough day, but we're so thankful that you participated and helped pull back that burden. There really has been a shift in the burden of Pompe, as Tiffany just mentioned in summarizing. Depending on when you were diagnosed, the treatments available have been able to, potentially alter the course of your condition, and we heard that today. But we also heard that no matter where you are, whether you're newly diagnosed, even diagnosed by newborn screening, or if you, were diagnosed before ERT was even available, that there's things that you need. There's things that you desire and would make an important impact in your life. And I'm just so gracious that you came along on this journey. We're willing to share that. I know there's even comments that came in that we weren't able to get to. I want to make one more pitch that we're going to keep those written comments open, that same form on the same page for the next 30 days. So, if you leave this meeting thinking, oh, there's just one thing I wish I could have said, or you're sitting at the dinner table tonight and something new pops into your mind, come back, give us that feedback. If you're watching this on demand and you weren't able to participate at the live meeting, within the next month, so through August 13th, we're going to be collecting those comments. Please write that in. Everything is going to be considered for that Voice of the Patient report. That Voice of the Patient report will land on, FDA reviewers' desks. It will go out to the, researchers and all of those developers, whether it's, the next generation of ERTs or gene therapies or other modalities. They're going to get that report, and it's going to help inform what they do. So, please continue to write in. It's been a truly incredible afternoon with all of you in this community. So with that, it's my honor now to hand us off to our closing remarks. We have Dr. Wilson Bryan, who is actually the director of the Office of Tissues and Advanced Therapies within FDA's Center for Biologics Evaluation and Research. So the person with responsibility over cell and gene therapy. So we're very excited to get to hear from Dr. Bryan. Take it away.
Good afternoon. I appreciate the opportunity to say a few words on behalf of the Food and Drug Administration. In the 1990s, before I came to the FDA, I was a neurologist and neuromuscular specialist in Dallas, Texas, and I had the privilege of taking care of a few patients with acid maltase deficiency. Unfortunately, at that time, we didn't have any treatments available for Pompe disease. We are fortunate that things have changed, that now there are treatments available, and these treatments have come about because the patient community has worked with the scientists and the pharmaceutical companies to bring these treatments forward. But we recognize that these treatments are not perfect. We need better treatments. The treatments that are available do not cure the disease, and there are side effects. But I am optimistic that the future will bring new and better treatments for Pompe, particularly since Pompe is an inherited disorder due to specific gene mutations. I believe that we will have gene therapies that will have a dramatic effect in this disease. Over the past few years, the FDA has approved the first 4 gene therapies that are on the market in the United States. Each of these gene therapies is for a severe, life-threatening, or disabling disease. What is encouraging is that the effect of these products is dramatic, that they change the lives of patients, that they, in some cases, save the lives of patients. And one of these gene therapies is for the treatment of a rare neuromuscular disorder, spinal muscular atrophy. All 4 of these gene therapies are for the treatment of rare diseases. In 2 cases, including the treatment for spinal muscular atrophy, the entire clinical trial development program involved less than 50 patients. So we can move products forward for treatment of very rare diseases. And I believe that in the years ahead, we will have a gene therapy that can be life-changing for patients with Pompe disease. And the proceedings of today's meeting, what we hear today from you, the patients and caregivers, will facilitate that development, and regulation of new therapies. At the FDA, when we listen to these meetings, we think about how are the clinical trials going to be designed? How do we need to design the clinical trials? And what you say helps us to think about what outcome measures, what clinical endpoints are meaningful, what matters to patients, and helps us to think about how to balance risks and benefits when looking at a new treatment. Which reminds me that while we may have had many excellent professors and teachers in medical school, most of the education in medicine occurs when we listen to our patients. And you teach us, you educate us when you participate in clinical trials, when you serve on our advisory committees, and when you participate and speak up in meetings like this. So I want to thank the organizers of this meeting, the Muscular Dystrophy Association, the Acid Maltase Deficiency Association, and the United Pompe Foundation for putting this meeting together to give us the opportunity to hear you. And particularly, I want to encourage you, the patients and caregivers, to continue to speak up. And at the FDA, we will continue to listen. Thank you.
Well, thank you so much, Dr. Bryan, for those words and for your perspectives and approach to truly exciting therapies for the Pompe disease community. Before we conclude today's meeting, I just want to offer a few more words of gratitude because truly it was a village that put this meeting together today. First, to the MDA team, who has worked for over a year at this point and putting together two meetings, both the in-person meeting in March that unfortunately could not happen, and then our virtual meeting today. Elise, Mark, Pam, Jeannie, Jennifer, Mark, Jessica, Jackie, Brittany, Chris, and everybody else. You all did a fantastic job, and it's been an honor to be part of the team. Thank you to all of our speakers, those who recorded your videos, those who participated over Zoom, Dr. Kishnani, Dr. Byrne, Dr. Bryan, Dr. Donahue, Tiffany. You all were fantastic. Also, a big thank you to John, Kyle, Eric, everybody at Dudley Digital Works. This all wouldn't be possible without all the folks behind the scenes right here making sure that this goes as smoothly as it's been going. Big thank you to James and to Larry Bauer of Hyman Phelps for assisting us along the way and for moderating today's meeting, as well as Sanofi and all of our sponsors for supporting today's meeting. And then, of course, most of all, thank you, the community, for attending today, and for making today a reality, and for rolling with the punches with us as we had to reschedule from the in-person option to today's virtual meeting. Something we truly could not predict, a pandemic hitting, just as we were hoping to bring the community together. As Dr. Bryan said, today is really just the beginning. Following today's meeting, we will be publishing a Voice of the Patient report, either later this year or very early next year, that really captures everything that was said today and then provide that to FDA so they are fully educated on Pompe disease, both what it's like to live with Pompe as well as the hopes and dreams for future treatments and perspectives on current treatments. And then as well, please continue to contribute, both by writing in through the web link that is on the patient-focused drug development page that you all found the live web link today. Continue to provide your comments for up to 30 days. We will include that in the Voice of the Patient report. But even outside this meeting, there are just so many opportunities to stay involved. I encourage you to check out fda.gov/patients because there are so many opportunities that the Food and Drug Administration is offering to really the entire patient community, but of course, the Pompe disease community. You'll find things such as the Patient Engagement Advisory Committee that the Center for Devices run. You'll find things such as the Patient Engagement Collaborative to advise FDA on how to be more patient-friendly, or the Patient Representative Program to actually serve as a patient representative at FDA. And also keep an eye on what MDA is going to be putting forward, because there are a ton of opportunities that are going to be coming your way. I ask you to check out MDA.org to familiarize yourself with everything that we do, much more than I could include in my opening remarks. But also, stay tuned with us on Twitter at MDA.org for everything we do, and then MDA_advocacy for everything we do on FDA, for everything we do with other regulatory agencies. There are so many ways for you to get involved. So remember, today is just the beginning. Your experiences and perspectives today start the conversation, but the conversation continues from here. Thank you for joining.